to hide. People were stigmatized. But then nowadays, I think people should come out, communicate, tell us, I'm living with HIV and AIDS. And whatever you see on the screen, that is rally in 21 kilometers race. And they are saying, this is more than just a race. It's not about racing. It's not about competing. It's a symbol of hope because it's a call to action and a reminder that together we can combat these challenges posed by HIV and AIDS, where athletes, advocates, the CEOs of this world, and supporters from all corners of the world have come together to not only run but also to make the difference in the fight of HIV and race. Na sijakuona kule Kasarani sababu I understand hii marathon pia has offered a range of race option. Kama wewe ni mtoto, kama wewe pia umezeka kidogo, kama wewe kuna wale wenye wadosi wana pesa lakini mbio pesa za shughuli zingine. Kumekuwa na kilomita 21 riadha ya ama mbio za kilomita 21, kumekuwa na kilomita 10 ya kila mtu ama public race, pia kumekuwa na kilomita 10 ya wheelchair, na pia tumeweza kuona kilomita 5 za corporate challenge na pia the CEOs, na pia tunatarajia kilomita 2. Sijakuona shughuli nzima ambayo imeaccommodate kila mtu.
Mwenzangu ukiona nafasi kila mtu. Nimeona mwenzangu pale Tony Kolanda akikimbia pale, ikanipatia pia hiyo energy ya kufika pale katika Nyayo. Lakini kuna jambo ambalo limetokea pale la watu kujitokeza kama unaishi na ukimwi. Yaani siku hizi watu waongopi, hakuna kitu mtu kama kuna ugonjwa wa ukimwi, unasema kwamba ni kuna ugonjwa wa ukimwi. That is the only way you'll get that protection from other things. And of course, you try to boost your immunity because, HIV, you need to have strong immunity so that you can cancel those diseases. But of course, nowadays, we have improved as the world because we are not in the analog days when people used to hide. But of course, nowadays when people grow, they tend to come out and say what they want. So if you have HIV, just come out, tell the doctor, because that is the only way daktari atakusaidia na utaishi vizuri katika maisha yako. So I was following one of the statistics here. Nasema kwamba ukiangalia Southeast Asia region, more than 95% of people are living with HIV. Southeast Asia huko. Unapata kuna Koreans huko, unapata watu wanaishi huko na ukimwi sana. So huko, siku leo inawapatia hiyo education. Unajua kama ni World AIDS Day, unajua kwamba leo lazima niingie pale, nijitokeze kama naishi na ukimwi, ni ugana na watu wengine. Maana ukiangalia wale watu wametokea pale ni watu wengi, wanariadha ambao wanakupatia hiyo challenge, wanakimbia, unapata CEO pale. Unajua ukimwi haichagui. Kama kuna ukimwi inaweza kuwa ni mtoto wa miaka 2, miaka 3, miaka 80. So ukikuwa na ukimwi inamaanisha kwamba maisha yako yamekatika. So ukiangalia pale, yani ni jambo zuri sana. Ukiangalia Wakenya wamejitokeza wengi sana kuchangia siku ya World AIDS Day, ambapo ni siku muhimu sana duniani.
Na pia ukiangalia kauli mbiu ama the marathon theme of this year, the marathon theme of this year in Kenya is promoting the health and well-being of men and boys. It seeks to raise fund support rehabilitation of wameweza kukusanywa na Nsdcc Council. Angalia tu among the statistics, wanauliza why are we championing mostly for men and boys? Why? According to the data by the National Syndemic Disease Control Council, wanasema in 2023 alone, the new cases of HIV infection among men and boys, were zilikuwa 5,968, where 44% of the numbers occurred among the ages of 15 to 34. In the same year, 487,710 men and boys were living with HIV, 2%. The numbers included 415,721 men above 15 years old and 35,989 boys between age of 0 to 14. The same year, 2023, 9,808 men and boys died from HIV and AIDS. That is with 70%, that is 6,859 being men above women, being men above 30 years old. data nzima ya mwaka uliopita, kuna data ya mwaka huu ambapo pia, lakini kabla nilete data ya mwaka huu, ambapo mwaka huu peke yake nikueleze mwaka 2024 ama in 2024 1,378,457 are the people currently living with HIV. 16,752 number of new infections. Tunalenga mwaka 2030 kuhakikisha kuwa sisi ama ugonjwa wa ukimwi tutakuwa nazungumzia mambo kama haya, tutakuwa tayari tumeupiga teke, umeondoka.
Umezungumzia pale men are mostly affected and boys are mostly affected with HIV/AIDS, and that is true because nowadays you see men are so neglected when it comes to protecting themselves. And of course, I've been checking what is happening, because whenever you are around and you are a human being, you should protect yourself, because health is the biggest achievement that you should have in this world. So men nowadays, they don't care on what is happening, because you see someone in the clubs, you see someone touring around, he doesn't look like wamejiachilia sana. So I think men are mostly affected because they don't care. You see someone doing some things that can really lead to affections, and also they make those moves that can lead to HIV/AIDS. So I think we should mostly educate men on this HIV/AIDS, because they seem not to understand that world is changing. And you know, men, they don't do things in the right way, because women have just erupted nowadays. Like, they care on what they do. You see a woman trying to do something and she's aware on what she is doing. So I think men should be educated, na hiyo tukiwapatia ile mafunzo, nafikiri ile ugonjwa katika wanaume itapunguza.
Na tukizungumzia tu baadhi ya wale ambao wameshinda, tukizungumzia tu baadhi ya wale ambao wameweza kushinda kwenye mbio hizi kilomita 21, naelekea nyumbani na kitita cha shilingi, ama will be walking home with 250,000. Number 2 is going home with 200, and number 3 is going home with 100,000 Kenya shillings. Kitita kizuri.
Ni pesa nzuri sana, na ukiangalia ukishinda pesa kama hizo zitakuwa bado zitakusaidia katika maisha yako, na vile vile ukiangalia ukishinda pesa zile, of course hatujui ni nani atakuwa anashinda, hatujui the status yake, lakini ukiangalia ukipata pesa kama zile zitakusaidia sana, na unajua uliipata siku ya World AIDS Day. So nashukuru sana wale wamechangia kutoa pesa kama zile. Ukiangalia wanariadha wengi wa Kenya wamejitokeza, na nimeona watu wengi sana wametokea katika hii marathon, na ni siku nzuri sana kwa Wakenya. Na vile vile ukipata pesa kama zile na wewe ni Mkenya, unajua Kenya mambo unaweza tumia vitu mingi sana pale ile pesa, na ukiangalia pesa kama ile umeipata siku ya World AIDS Day. So nashukuru sana wale wametoa pesa kama zile na Wakenya kutokezea pale, na itawasaidia sana. Ukiangalia pale vile wanakimbia, yani hata tumemwona pale CS anakimbia. So nishana kwamba ni kitu ya maana sana duniani na itakusaidia.
Ulizungumzia kuhusu baadhi ya nchi ambazo zimekumbwa sana na ugonjwa huu, ama ambazo zimekumbwa sana na ugonjwa huu, na ukazungumzia kuhusu baadhi ya zile nchi, ndio ukasema Southeast Asia. Baadhi ya nchi ambazo ziko katika South Asia ni Brunei, Burma, Cambodia, Indonesia, Laos, Malaysia, Philippines, Singapore, Thailand and Vietnam. Ni baadhi ya zile nchi ambazo walikuwa wanazungumzia ambazo ziko katika eneo la Southeast Asia.
Ukiangalia nimekuwa nafuatilia vile watu wanafanya shughuli zao pale, unapata watu wengi sana, na si watu wote. Kuna watu ambao wanajiachilia sana hizo nchi. Ukiangalia nilikuwa nafuatilia statistics za pale Malaysia. Unajua Malaysia watu wengi sana, unajua wakiishi huko ni Southeast Asia. Yaani unapata watu wengi huko wanajibamba sana, wanaingia katika sherehe, na hawajui kwamba ukikuwa na ugonjwa kama ule itakuwa ina kuaffect certainly in one way or the other. So nikiangalia ule ugonjwa huko, wanafaa wapate ile education, wapate ile elimu, ndio wajue kwamba ugonjwa kama ule unaweza affect sana katika maisha, na kama mtu ako nayo ile stigmatization iko inapungua. Maana ukiangalia, ukishajua, watu wengi wanaishi kama hawajui kama wako na ugonjwa ukimwi, lakini ukipata uko na ugonjwa wa ukimwi unapata uko na ile stigma. So natumai kwamba watapata ile mafunzo ndio waweze kuishi vizuri, na siku ya ukimwi duniani ni siku kuu sana.
Let's listen to the 10 kilometers winner who is having an interview.
For that motivation, so if you can't run, definitely you can be here to support them. It will be here at the Nyayo National Stadium. The gates are open. Kuja ujibambe na sisi.
We are coming live from Nyayo National Stadium, or rather, that is our reporter, Tony Kolanda, is on the ground from Nyayo National Stadium, where the Nsdcc World AIDS Day 2024 Half Marathon is happening. Earlier today, we have seen the 21 kilometers race, and the winner of the 21 kilometer race is Jonathan Korir. Number 2 is Wesley Kipkemoi. Number 3 is Eric Kiplangat. Number 4, Kenneth Langat. And number 5 is Leonard Langat. That is men's 21 kilometers race result. In 21 kilometers women's race result, we have seen Viola Chenwetich is the winner of the 21 kilometer women's race. Jessica Chelangat came second, while Grancy Jebitich came third.
Challenges. Kosi imekuwa vizuri sana. Si mbio ya kwanza, nimekuwa nikikimbia tu bado. Ya mwisho nilikimbia ilikuwa 10 km plus off. Yes. Na labda unafanyia kuendeleza what other. Okay, saizi nafikiria kuendelea na cross country. Yes.
Na pengine tuambie kijumla umeona vipi competition imekuwaje katika hiyo?
Competition imekuwa mzuri sana, sijaona any challenge. Nilikuwa nimeipulipia vizuri. Yes.
Na pengine course yenyewe umeiona je? Maana ukiangalia
course imekuwa mzuri. Yeah. Imekuwa na mlima kidogo challenging, but nimejaribu. Yeah.
Course wengi utumia hizo mbio kupanga in future. Pengine in future unataka kwenda wapi?
Okay, in future nafikiria kuingia cross country. Yeah.
National ama hizi?
No, naenda kukimbia Likalau. Weekend meeting. Yeah.
Pengine message yako ya mwisho pengine kijumla kuhusu hiyo hizi, na pia leo ni siku ya kimataifa ya kinda. Message yako ni ipi?
Message yangu naambia Wakenya wenzangu waendelee kushiriki mbio zote zile, maana zinatusaidia katika hii maisha. Yeah.
Okay, asante sana. This is the second for the 10 kilometers men's race. Labda uanze na majina yako na utueleze mbio imekuwaje leo.
Kwa majina yangu ni Shadrack Kibiegon Korir from Nakuru County, Keringet. Hapo ndio mahali na trainia. Mbio ya leo ilikuwa mzuri, ingawa challenges ilikuwa mamilima. But nilijaribu tu kubush mpaka mahali nimefika, na shukuru tu.
Na ukiangalia competition ya hii leo, competition ilikuwa aje? Ndio unaona umeweza kuwa nambari ya pili, una feel competition ilikuwa sawa?
Competition ya leo haikuwa competitive kulingana na yenye nilikimbia last week, ilikuwa competitive. So ya leo haikuwa competitive kama la ya last week. Last week nilikimbia Kirdam 10 kilometers. Nikachukua position 1. So ya leo nilisema wacha niende nijaribu nione kama bado mwili naenda. But nilisikia haikuwa mbaya, inasonga, ingawa tu uchovu bado iko kwa mwili. But nilingangana mpaka nikakuwa position 2.
Na labda future plans ambayo uko nayo for the next run ni zipi?
Kwa sasa naenda ku take full recovery, ndio ikifika next year sasa nianze program ya next year. Hii ndio race yangu ya mwisho.
Yes. Na labda swali la mwisho, umekuwa ukitrain wapi, na ukiangalia hilo some of the challenges ambayo umepata leo, labda what are you planning to do ili urectify kwa the next race?
Kwa program yangu na mahali na trainia iko high altitude 2700. So na kuna mamilima pia, hiyo ndio ilinisaidia mpaka nikakuwa position 2 kwa siku ya leo.
Okay, na wewe ni position 2, unahisi vipi hilo?
Nahisi mzuri juu kukua top 10 in Kenya si rahisi. Ukikuwa top 10 shukuru Mungu. Tunaona mazoezi yako ni mzuri na unaenda ku achieve your dreams. Yes.
Asante sana. Congratulations.
Asante.
All right, ungependa uanze na jina yako, umecomplete race gani, na hiyo mbio hii leo imekuwa vipi kwako?
Kwa majina naitwa Kipkemoi Penatrono. nimekimbia 10 kilomita na mbio ilikuwa moto sana, kwa maana nimekuwa nikitrain kwa muda mfupi. Nimetrain for 3 months na inaona si mbaya, kwa maana nimeshika 15 na pia ninashukuru Mungu pia kwa maana ameniwezesha nishike hiyo namba. Nimekuwa na changamoto kubwa huku nikipiga mazoezi. Nilikuwa na injury ilianza 2017 na ninaona sasa nimeimprove na pia Mungu amenisaidia.
Labda ukiangalia competition ya leo, ulifeel hiyo competition ilikuwa aje?
Hii competition ya leo ninaona ingawa ilikuwa moto, nimeimprove kwa maana nimetoka juzi, nilikuwa nimekimbia 21 kilomita na nimeona nimeimprove leo. Ndio ninashukuru Mungu.
Future races ni gani ambazo to expect kutoka kwako?
For the next future, my race will be now, I'll be carried 21 kilometer and 10. So hiyo ndio ninaona nitaweza kwa uko mbele.
Congratulations.
Asante sana.
Ningependa ujiintroduce, uanze na majina yako, songa nyuma kidogo. Uanze na majina yako, umecomplete race gani hiyo, matokeo imekuwa vipi na kwako mbio ilikuwaje hii leo?
Asante. Kwa majina yangu naitwa Peter Mutie Makao. Kutoka Machakos County. Nimeshiriki mbio ya 21 kilometers. Haikuwa mbaya vile, nimeweza kwenda time ya 68 minutes. Ambapo nimejitahidi yangu the best. Challenge yenye nimekuwa nayo ni viatu kidogo, lakini with the time nitapata viatu alafu mambo iende vizuri. So shukrani, sina mengi, asante.
Labda ukiangalia course ambayo uliweza kukimbia hii leo, hiyo course ilikuwa vipi kwako? Ulihisi ugumu wowote?
Si kuhusu ugumu wote. Ilikuwa shwari kabisa, niliweza kupambana, nilianza kupambana kama kule kwa milima niko sawa, nimefanya mazoezi kule kwa milima, nimekuwa Iten, lakini nyumbani maskani ni Machakos, but ninaendanga Iten nafanya training. So kwa milima sikuwa na hali mbaya vile, nimejaribu yangu yote, nimeweza kung'ang'ana. Sasa shida ni ile tu kiatu, nikipata kiatu mambo itaenda. Asante.
Na ukiangalia sehemu upande wa competition, umehisi vipi about the competition ambayo imekuwa hii leo?
Competition ya leo haikuwa mbaya vile, weather ilikuwa shwari kabisa, mambo ilikuwa shwari. Nimefanya mazoezi kwa baridi, altitude, mambo imekuwa vizuri kabisa. Sasa hali ya weather iko sawa, shwari kabisa.
In the future unapania kujoin future races gani zingine?
In the future, kama mwaka ambao tunakuja 2025, ningetaka niende 42 kilometers. The 42 kilometers na time yangu ninaomba niweze kufanya mazoezi ili nipige kama 2 hours 17 minutes, na I think things will go. Na pia niko najitayarisha kwa mbio za uwanja mwaka ambao unakuja, niweze kushiriki niende ngambo.
Right, asante sana and congratulations.
Thank you, asante pia mimi.
Okay, we still have one participant also. Please introduce yourself na utueleze ni race gani ambayo umeweza kuparticipate and why did you come out to participate in today's race?
Okay. Kwa majina naitwa Eric Mutuku Mwandwa. This is my first day to run marathon, but I ran paramilitary academy, Nsdcc. For now I come here to focus myself because this is my dream, and nimejaribu because 21 kilometers nimekimbia less than 1 hour. I try naambia wenzangu pia wenye wanataka kukimbia pia wajaribu because this is my first time, but nimefocus, nimepata my certificate, nimepata my nia, so namshukuru Mungu sana.
Ukiangalia hiyo course ulihisi vipi na labda ulifeel aje pia kuhusu the competition?
Okay, nimetry kukimbia peke yangu, nafanya zoezi, nikasikia kuna marathon today, nikasema hata mimi nitajiunga na wale wengine naona wakikimbia kwa barabarani, wengine different units, nikasema nitakuja ni focus na wao nijaribu, but nimeona niko mahali pazuri. Next time I will hemu haya na nitajaribu kuendelea mbele.
Right, congratulations. Thank you for speaking to us. All right, we still do have other participants who are coming in and streaking through the finish line. And labda tu uweze kujiintroduce, jina lako ni nani, alafu umeparticipate mbio gani hizo, na mbio hizo zimekuwaje kwako?
Okay, my name is Jafet Jackson. I'm from Nsdcc. Mi nimekuja hapa participate 10 kilometers. This is my second time. My aim is to run for my time. Na mbio imekuwa too tough, lakini sasa
challenge kwako imekuwa ni lini? Umesema imekuwa ni tough. Challenge kwako imekuwa ni nini leo?
Challenge sana imekuwa mazoezi, sitapika zoezi sana, lakini nimetry my best.
Na ukiangalia labda what are your future plans kuhusu masuala ya races?
My future nataka ni focus on marathons na track, mostly on long races. Okay.
All right, congratulations and thank you for talking to us.
Thank you, Tom.
Okay, we also have other participants. If you could just join us here on set. Please introduce yourself. Unatoka wapi, umeparticipate kwa mbio gani, na mbio imekuwaje kwako hii leo?
Okay, thank you so much. I'm Asha Omondi Otieno. I'm a public health officer by profession from Mary University and of Science and Technology. I'm very happy for the rest of today. I was really prepared, being that I was one of the athletes at Mary University, and being that I'm a public health officer, and our main role is preventing diseases, prolonging life, and also promoting health. So today has been a great day for all of us today, because the day reminds us that AIDS is a killer disease, and therefore prevention is the key. And everyone is will be aware that today is a great day.
Yes. Thank you for speaking with us. We appreciate. This has been me, Sheila Chelangat, here at the finish line as we speak to some of the participants who participated in the 10-kilometer races, 21-kilometer men and women, and we did see the first of men and women as well get through the finish line. But for now, let me hand over to my colleague Tony Kwalanda on the other side. Let's get to hear what do you have for us, Tony.
Indeed. Thank you very much, Sheila Chelangat. Tony Kwalanda here. I am along, this is Langata Road. And as you can see, that's a roundabout that connects just next to Nyayo National Stadium that goes to Langata Road. That's where I'm standing. It's one of the routes. As you can see, there's a lot of action. This should be part of the 10-kilometer, the 5-kilometer, and maybe some of the 2-kilometer who actually were a bit very slow. So they are here now making their way towards the roundabout on Langata Road. Pale karibu na pale ile University of Strathmore. Then they come back and finish next to Nyayo National Stadium on as they head sort of to Bunyala Road. So we are here live inaendelea vizuri kabisa. As you can see, I mean, there's a lot of action. Let me just quickly bring in one of those participants. Tuambie wewe una participate race gani? Naona umeshapatiwa medali. Ilikuwa mbio gani? Mbio shughuli ilienda vipi? Karibia hapa hivi. Yes.
Mimi nimeparticipate kwa the 2-kilometer race.
Yes.
Kwa vile ukiangalia mimi ni mkongwe, singetaka kuenda ile ya mbali sana.
Yes.
Lakini pia kama mwanaume, yes, symbolically ilikuwa lazima niende hii race kwa sababu ukiangalia maneno ya HIV, yes, na wanaume wao wanasaulika na pia huwa hawaongei, lakini ukifuatilia kwa ndani kabisa, yes, utapata kuna maneno nyingi hapa yenye inafaa iseme. Ndio kwa maana nimeshirika kwa hii.
Well done.
Yeah.
Yes, of course.
Yes.
Thank you very much for really participating.
Yes. Mimi kwa majina mimi majina naitwa Eric Okioma. Natoka organization inaitwa Nelson Mandela TB/HIV CBO na inatoka kule Kisumu na napatikana kule Nyalenda. Yeah. Na pia mimi ni mtu mwenye naishi na virusi. Asante sana.
Asante sana. Thank you for supporting this particular initiative. Na tunashukuru sana sababu imeweza ku create that awareness about this, especially men na boys. Hao ndio wanapatikana na hiyo tumewachiliwa sana kabisa, yani paka tumesaulika. Ni kwa sababu saa zingine wanaona wanaume kama ndio wako na nguvu, lakini si hivyo. Tukiangalia maneno tuseme kama ile ya jamii, wanaume ndio saa zingine kwa kimsingi Kiafrika au ndio wanaongoza familia, lakini si ati sasa kama unaongoza ati hizi vitu kama maradhi, hizi vitu kama GBV, vitu zote tu pia huwa wanasikia uzito. Kwa hivyo ni vizuri sana ijitokeze nje, na pia watu wengi wafikiria saa zile wanatengeneza kama hizi programs wa make sure wame design ile yenye responsive to men's need. Na serikali imefanya kazi ya kutosha ili kuweza kutoa hiyo stigmatization na pia kuweka watu wetu wale ambao wanapitia. Serikali imechangia kazi yake vizuri.
Pia hatuwezi sema sana kwa sababu najua programu yoyote kama pesa lazima itengwe, kwa sababu ukiangalia kuna ati Women Enterprise Fund, vitu kama hizo. Hatuna vitu kama Men's Enterprise Fund. Mpaka sasa imesaulika. So kwa hapo ni mikakati yenye lazima pia waangalie. Lazima pia pesa, lazima watu watenge vitu zenye zinaweza kutusaidia pia tufika hapo, kwa sababu ukiangalia miradi nyingi sana unapata ati inaangalia sehemu za wanaume sana. Kwa sababu hata saa hizi tukiangalia hata vizuri, utapata saa zingine kama saa hizi ukienda kwa majela zetu, utapata vijana wadogo ni wengi sana, na ukiangalia vizuri ni vitu zenye zinaweza kingika na vitu zenye haziwezi fanyika. Zingine pia saa zingine ukiangalia katika haki za kijamii, saa zingine ni kitu yenye lazima iangaliwe, kwa sababu utapata mwanaume kwa vile ongei, sasa saa zingine kusema ukweli inaweza kuwa ngumu sana, kwa sababu mwanaume akishapatwa na jambo fulani wanaona ni kama yeye ndiye ameleta, yeye ndiye ako na shida zote, na hiyo ndio kitu yenye lazima tuanze kuangalia ili tuangalie katika haki za binadamu. Wanaume pia ni binadamu kama wenzetu.
Asante. Thank you very much. Shukran sana kwa kuweza of course kutuarifu, na mmesikia kwamba ni mmoja ambao ameshiriki katika mbio hizi ama mashindano haya World AIDS Day Half Marathon ambayo inafanyika hapa Nyayo National Stadium. Pia wakati huu ningependa kuweza kuwaleta hapa, wacha nitavuruta hii kidogo tu hapo iruke kidogo. Ni mambo tunaweza kutaka tuwakaribie kidogo tu ili waweze kutuelezea ni kina nani wameshiriki mbio gani, ilikuwa mbio hipi, walimaliza nafasi ya nambari gani. Wacha nikuulize, tueleze, tell us your name.
I'm Joshua.
Yes, which race have you participated in or exactly umefanya nini hapa? Naona umeshavaa, umeweka medali. How was the race? Ulimaliza katika namba gani na ni kwa nini uko hapa leo?
Sawa. Mimi hii ndio mara yangu ya kwanza kuparticipate kwa race. Najua ni mara yangu ya kwanza, haijakuwa rahisi vile, lakini nimejaribu, nimekuja namba 10. Imekuwa mzuri, nimeng'ang'ana venye naweza.
Na wewe of course ni World AIDS Day, ni kwa nini umekuja kuweza kukimbia mbio hizi? Na unakumbuka kwamba kila sehemu ya dunia wanasherehekea ama wanaadhimisha hii siku ya AIDS Day.
Naweza sema juu hii ni siku ya wenye wako na AIDS, naweza waambia tu hata wenye wamepata AIDS bado dawa ziko, wazingatie, na wenye bado hawajapata wajaribu kujikinga, si ugonjwa mzuri.
Thank you very much. Asante sana. Wacha nilete dada yetu hapa, utueleze jina zako. You can use any language, English, Kiswahili, whichever language makes you happy. Yes. So tell us your name, which race you participated in. I have seen you have a medal. How was the race? And of course, kwa nini leo ulikuja kusherehekea ama kucommemorate World AIDS Day Half Marathon?
Naitwa Christine. Today actually it's World AIDS Day. Na nilikuwa na participate 10 kilometers, and actually it is not easy.
Good to have the experience with the barabara. Yes.
It was commemorated first in 1988, and this is the first day we've commemorated the World AIDS Day through the use of a marathon. A marathon is a symbol of what unites us together as a country. We know that we are a leading marathoner in the world, and we produce the best. And we decided that let's have this event commemorated with what we love doing most. We are happy that many people have turned out, have ran 5 kilometers. I've also gone for the 2 kilometers, and I'm excited I have finished the race. I think
How was the race course for you?
Tough. I must admit, very tough. I had muscle pulls. I almost gave up at one point, but then I reminded myself the theme of this marathon is to finish the race. And we are talking about a disease that has been with us for so long, has affected generations. I was with our mothers, now we are mothers, and it's also been passed on to our children. And it's a time as a community we say enough is enough. We become proactive. We talk about HIV to our children. We also talk about the fact that we must be open up to say this is a virus and it is in human beings and it is transmitted through sexual intercourse, through mother-to-child transmission of HIV, through injecting drug practices, and so that our children can know how to prevent it. I think we may want to come out of our own individual closets and talk about HIV, but also most importantly, talk about stigma. Because it's stigma that has kept people away from talking about this disease. It is stigma that has made people say the disease is over, when still we have about 16,700 new HIV infections every year. We had those in 2023. We had more than 20,000 AIDS-related deaths, and 1.38 million people are on treatment, and they have a daily dosage of treatment. But most importantly, to celebrate success. As a country, communities, we have done well. We have reduced new HIV infections by about 83% in the last 10 years. So we are making progress. Also, the deaths have reduced significantly. There's a time we had deaths like 2013, about 50,000 and more. So we've reduced that to about 20,000. But most importantly is also to spotlight on one subpopulation, men and boys. Our men and boys have not traditionally gone to the facilities. We are seeing them coming too late, especially when they get HIV. They come for diagnosis too late, and then we are trying to say that men and boys can play a significant role as champions. We also know that the country is struggling with teenage pregnancies. We are struggling with sexual and gender-based violence cases, and we are also struggling with new HIV infections among the younger people. And we want both boys and girls and men and women to come together because, as you know, that most of our infections are through sexual transmission. And we must speak about sex openly because children must learn at their age what it means. And then as they grow up, they continue learning about age-appropriate language. We don't want our children to be told children come from, are dropped from the aeroplane anymore. We don't want them to be lied to. The children are bought. We want parents to be able to say, you were born. And as they grow up, they know how it is. My mother got pregnant, and getting pregnant at the right age is okay. And we begin to be more open in terms of how we discuss sex and sexuality.
Maybe the comparison between the infection, the number of people infected vis-a-vis those under treatment. How's the funding?
So we have about 1.38 million people on treatment. And new infections, we usually look at them and estimate them every year. So we had about 16,700. So what has happened right now in the country, the new infections are going down, but we're seeing the deaths now, we are lower. New infections, the deaths are higher. So that also is a problem because it means that there are people you are missing out to give them medication early. We know when you're on treatment, you don't progress to AIDS. We also know when you're on treatment, you don't transmit because your virus is suppressed. So what we are doing is to say that we want to reduce the number of AIDS-related deaths so that as we reduce new infections, we only have the people we are taking care of, and which is what they come into the question about funding. For a long time, we've been depending especially on commodities for HIV, cost about 25.4 billion every year just for commodities for the disease, which we count with about 6 months of buffer. And most importantly is that the challenge we have now is that as donors who have been with us for are saying that there's no more money. It's a high time also we begin to say as a country, how do we mobilize our own resources? How do we begin to start with the resource we have, which is the human resource? The human resource is me and you. Speaking to our children, that is unpaid human resource, but it's a human resource that can lead to prevention. The government is also making plans on how to try and get some of these commodities locally. We are exploring condom manufacturing, for example. We are also exploring how to have some of those companies come and manufacture. We have about 2 companies now that are approved by the WHO to manufacture the first line of ARVs in the country. So we are making progress in that direction of self-sufficiency. However, it's still a challenge, and we are saying that if we can come as a country together, get solutions, stop new infections, and make sure that those who are living with HIV are protected from stigma and they access treatment and live a full life. That is why this day for us is significant. This marathon is significant because we wanted to reach to everyone in this country, everyone watching us today from home, everyone who has come to race. No matter how the race was, you may have been the slowest, but in the end, you won the race.
Yes. And there is the goal for 2030 to eliminate HIV as a public health threat. How far, it is just 6 years down the line, how is Kenya doing towards that goal?
So we are achieving some of the targets, and one of the targets we've done well is the target about getting people diagnosed, and we have at least diagnosed 95% of the people living with HIV. We have 5%, and those are too many, it's hard to find them. Then of estimated 1.4 million people, so you have 5% that you haven't found, about 41,000, they are not on treatment. And then the next goal that we are almost reaching is the goal of ensuring everyone who is diagnosed on treatment. We have reached 97%, and then the outcome of treatment is viral suppression, and we are at 94%. So we are shy of those goals. But the target that we have a problem with is the target of reaching less than 5% transmission of total transmission of HIV. Currently, we are at 7.3%. The new HIV infections are far too long, too far. I mean, we were supposed to be less than 1,000 by 2030. So we have 6 years to deal with about 16,700 new infections. So you can imagine the journey we have to run. It's actually a race because it's taken us just 10 years to reduce by 83%. And we have just 6 years to say we want less than 1,000 new HIV infections. And also we want to reduce deaths, because how you measure an epidemic control is that people who have been infected, which we call the incidence and mortality ratios, should actually be less than 0.03%. So what we are saying is that those figures must come down, and by 2030, we come here and then finish the race and say that no one is stigmatized in this country. We have our commodities, we are self-sufficient, and tell our children there was AIDS and it is gone. And that it means that it's no longer a public threat. If anyone is getting infected, they'll also just get treatment, and they're too.
And perhaps finally, this race was not for just seeking awareness, but also raising funds. Perhaps what do you hope to do with those funds that have been collected today?
So, first of all, we are a community of people living with HIV, and the majority of the people also who have turned up are community members. And we also know that there are Kenyans who have come. So any resource that will be raised for this particular race, we are giving it to the people who inject drugs, community of people who inject drugs. And the reason why we are doing this is because as a country, we have about 26,000 community of people who inject drugs, and we've been giving them access to treatment. However, what we have realized is that most of them, after they are treated, they want to live a normal life. They don't have a start place. Currently, we got about 16 of them, taking them to technical schools. And what we are trying to say is that as Kenyans, there's something we can do for ourselves. If somebody was on drug use and they are now recovered, surely we don't want to wait for a donor to come and reform them. We are talking about social reintegration. Some of them were lawyers, others were even big people. Some of them were at the university where they dropped off. We also have found children as young as age of 14. We want to look for their parents. We want to trace what the donors can do for us. So we want to make sure that that program is saving lives. We are transforming those people. We don't want to treat people, which we spend almost 1 billion Kenya shillings to buy the drugs, and then we take them back to the streets, because that is where most of them are. That's why we are finding them. So this is one of the things. Then the other cause we also want to do is that to call out for every adolescent mother to go back to school, because school is an equalizer. Education is an equalizer. We want to continue calling out that every person who is an adolescent mother is given a chance to go back to school. And when she goes back to school, we know that the future is better for her, and that she will also be able to take care of her child in later years. Thank you.
Right. Thank you so much, Madam CEO. Okay.
Unaweza tumia trust kujikinga, na kama umepata AIDS vile unaweza meza PrEP vitu kama hizo. So to youth tujikinge, hii ugonjwa iko real, si uongo.
Na watu wa mtaani unawaambia ni unajua ina affect sana maboy sana men, alafu men pia nakwanga watu wamenyamaza hapendi kusema mambo yao.
If you can't abstain, use trust. Yes, use trust.
Condom.
Yes.
Unaogopa kusema tumia mipira.
Tumieni mpira. Hiyo ugonjwa itatumaliza. So kitu tu tunaweza fanya tutumie mpira. Most of the youths hawataki kuabstain. Yeah.
Asante. Well done. Of course. And what would you tell about those who inject themselves? Unajua vijana siku hizi wanaji-inject na madrugs and then of course leads them into a lot of misbehavior in terms of that, and wanapata virusi. Unawaambia nini wa vijana? Wako mtaani unajua ni wengi wale wanatumia hizo madrugs.
Wako wengi sana. Vijana wenye wanatumia madrugs wako wengi sana. So kama unatumia drug na uwezi waacha ama unataki kuacha, make sure unatumia kidogo. Usitumie mingi sana. Ukitumia mingi unaweza sijui unaanza kupiga mtu, sijui unaharibu vitu za watu. Tumia tu kidogo kama ni lazima, hujakatazwa.
Asante sana. Thank you very much.
Yes. Alafu against one thing, wenye wanasikia na wa invite kwa event ya Mr. and Miss Starehe constituency yenye inafanyika 12th December, South B iko tu hapa karibu. Our Lady Queen of Peace from 8 a.m. to 7 p.m. Come and help us crown the new Mr. and Miss Starehe constituency.
Asante sana, nitakuja huko. And of course, wewe uko hapa, wewe umekimbia race gani na ni nini inafanyika, na ama umekuja kufanya nini hapa hivi? Wewe uko tu umekaa mkunywa maji.
Sasa okay. Mimi naitwa Javulani, mimi ni actor. Mimi nimekimbia 21 kilometers.
Ya ukweli.
Ya ukweli. By the way nakwanga fit tunachikia hata mwili yangu, hii ni mwili ya marathon. Yeah, so na nimekuja kuambia wasee tusikue tuna stigmatize watu wako na AIDS. Unajua si lazima mtu alikuwa na tabia mbaya ndiye akaipata. Kuna watu wanazaliwa nayo na that's out of their control. Alafu pia ni fate, hakuna mtu plan kwenye life yake itaenda. Kuna watu wanapata pia magonjwa zingine kama high blood pressure, diabetes, na they have to live with them. So usikuna stigmatize msee atujinisikia kuna AIDS. Wewe bora tu ujikinge ile design hiyo uwezi ipata. Yeah, we can reduce the rate of new infections, but we have to live well with those who are already infected. Sawa? Hiyo tu ndio message yangu ya leo.
Asante pia rembo hapa, unajua wasiseme tu tulikuwa hapa tukawapatia chance wakaongea tu na Miss Starehe peke yake. Kama jina lako nimekuja kufanya nini, kwa nini umekuja kucommemorate day ya World AIDS Day?
My name is Claire Kemunto. I'm an actress here. So I'm happy kukuwa hapa to create AIDS awareness. Manze, ikitu ni real. Guys, if you can abstain, just please do abstain. Alafu kwa wenye already wako nayo, cause kuna wasa wako nayo da. So just come out, don't feel stigmatized. Come out in the open, meza madawa. Kitu ya kwanza ni acceptance. Ukisha accept, hata unaweza ishi na hii kitu hata for more than 20 years. You can still achieve your dreams. You can still do whatever you wanted to do with your life. It's not the end of life, you know. Hii ni kitu watu wanaishi nayo. You accept yourself, then you go seek advice. Kitu unaweza acha, kitu unaweza tumia, chakula. You start eating healthy. You start doing gym, vitu kaa hizo. Na utapata you're living a happier life. Close to, hata si ati close, a normal life. A perfect life. Even better than yenye ungekuwa bila AIDS.
Yeah. Asanteni sana. Enjoy. We'll see you of course kule Starehe umesema tarehe 12. Nashukuru sana. And of course enjoy yourselves. Hope to see you at the award ceremony. All right. Asante, karibu sana. Asante sana. Live of course hapa Lang'ata Road 1 2 3 kuweza kushabikia ama kuongea wale mashabiki ambao wamekuja hapa hivi kuongea ama kupiga shughuli ya mazoezi ama pia kufanya kukimbia kwa hizi mbio za World AIDS Day Half Marathon. Kama ningependa kumrushia Duncan ama Sheila ama yote ambaye ako standby kwangu hapa Lang'ata Road, mimi nataka kutafuta watu wengine, tuonana baadaye.
Naam, shukrani sana Tony Kwalanda, kazi safi ukiwa ground. Wewe pia Sheila Chelangat ambaye pia ameweza kuzungumza na baadhi ya wale ambao wameweza kushinda. Kumbuka leo ni siku ya kuidhinisha ama ni siku ambayo watu wanajitokeza basi wameweza kukimbia kama njia moja kuidhinisha siku ya ugonjwa wa ukimwi, ambapo tumeweza kushuhudia riadha ama tumeweza kushuhudia mashindano tofauti ama mbio tofauti zikiweza kukimbiliwa katika uwanja ama zikiweza kuanza rasmi katika uwanja wa Nyayo. Kwa sasa shughuli nzima inaendelea kukamilika, naelewa mbio za mita ama mbio za kilomita 21 kilomita zimeweza kukamilika, na baadhi ya wale ambao wameweza kutoa ushindi kwenye mbio hizo, basi mtazamaji, ni baadhi ya wale ambao wameweza kutamba na kutoa ushindi haswa kwenye mbio hizi kwenye kilomita 21. Tumeweza kushuhudia Wesley Kipkemoi akiweza kutoa ushindi kwenye mbio ama Wesley Kipkemoi akiweza kuja katika nafasi ya pili, Jonathan Korir akiweza kutoa ushindi kwenye makala haya ama kwenye mashindano haya mwaka 2024 ya siku ya ugonjwa wa ukimwi. Pia Eric Kiplangat ameweza kumaliza katika nafasi ya 3 kwenye mbio hizo. Viola Chemwetich pia ameweza kumaliza wa kwanza katika kitengo cha kina dada mbio za kilomita 21, na pia kwenye mbio hizo za kilomita 21 tumeweza kushuhudia Jessica Chelangat akimaliza katika nafasi ya pili, Grancy Jebitich pia akimaliza katika nafasi ya 3. Kumbuke pia kuna zawadi tofauti kwa wale ambao wameweza kutoa ushindi katika riadha hizi. Kuna zawadi za kifedha pia. Katika mbio za kilomita 10 tumeweza kushuhudia Dennis Ndungu akitoa ushindi katika mbio ama Dennis Ndungu akitoa ushindi katika mbio za kilomita 10 ya ile ambayo tunasema wheelchair race, akifuatiwa kwa karibu sana na John Wambua ambaye amemaliza katika nafasi ya pili. Kumbuke ni siku ambayo tunaidhinisha siku ya ugonjwa wa ukimwi duniani, ambapo pia kama njia moja ya kuidhinisha siku hizi, basi Nsdcc imeweza kuandaa riadha katika ama imeweza kuandaa mashindano ya riadha katika eneo la Nyayo ama katika uwanja wa Nyayo. Pia kando na riadha kutakuwa na shughuli nzima, kutakuwa na mazungumzo basi kuweza kueleza ama kuweza kuwaelimisha watu, wananchi na pia dunia mzima. Je, hadhari za ugonjwa hizi ni zipi? Ni vipi ambavyo wewe ukiwa nyumbani, ni vipi ambavyo wewe ukiwa kazini, na pia wewe ukiwa shughuli zako za kila siku unaweza jiepusha na ugonjwa ama unaweza jiepusha na ugonjwa huu. Lengo kuu haswa likiwa pia ni kulenga mwisho ama lengo kuu likiwa mwaka 2030 basi kusikuwe na kisa chochote cha ugonjwa huu wa ukimwi ambao ni ugonjwa ambao umeweza kuadhiri watu wengi, umeweza kuadhiri familia na pia jamii tofauti duniani ama jamii tofauti duniani. Ikiwa ni siku ya kwanza ya mwezi wa Disemba, hii huwa ni siku rasmi basi ya kuidhinisha siku ya ugonjwa wa ukimwi, ambapo pia kirasmi tumeweza kushuhudia riadha humu nchini, haswa ikiwa ni main event ya humu nchini. Pia kaunti tofauti pia wameweza kuandaa hafla tofauti zikiwa pia upanzi wa miti, na kama studioni pia tumeweza kuona studioni, nikiwa hapa studioni ni naye Boniface Kimanzi. Boniface, wanasema kuna ile hashtag alama ya reli pale, wanasema #EndAIDS by the year 2020 by the year 2030.
Nimeona kuna mwanadada hapo amesema kwamba Kenyans watumie mipira ndio waweze kuzuia ugonjwa huu wa ukimwi, ambao ni ugonjwa ambao ukipata uko nao utapata ile stigma. Na nimekuwa nikifuatilia zile nchi ambazo ziko na high rates of HIV in Africa, na kuna Eswatini inasemekana kwamba iko na wagonjwa wengi sana ambao kuna ukimwi. Kuna Lesotho, kuna Botswana, pale Botswana, Gaborone wanasema kwamba pale Gaborone kuna ugonjwa sana wa ukimwi. Kuna pale South Africa, pale Afrika Kusini kuna Mozambique iko pale, vile vile kuna Zimbabwe, kuna Namibia, na vile vile pale Zambia inasemekana kwamba kuna ugonjwa wa ukimwi sana. So ukiangalia Kenya hatujaorodheshwa pale katika nchi ambazo ziko na ugonjwa wa ukimwi, na inaishara kwamba Kenya tutumie ile mipira ndio tuweze kuhakikisha kwamba tumezuilia ugonjwa huu wa ukimwi. Na vile vile ukiangalia kuna zile nchi ambazo zimetajwa kuwa kwamba zilikuwa na lowest rates of HIV. Kuna vile vile kuna Hungary, ambapo pale Hungary wanasema kwamba wako na ile low rate of HIV wakiwa na Slovak Republic. Yani pale Slovakia wanasema kwamba pale rates of HIV iko chini sana, ikisema kwamba ni ishara kwamba yani ukiangalia zile nchi ambazo ziko na low rates of HIV wako na zile measures ambazo zinazuia HIV, na moja ni kutumia mipira. Wakati unatumia mipira unahakikisha kwamba umezuilia kama ni ugonjwa yoyote, na sio HIV peke yake, kuna magonjwa mengine ambayo unaweza pata kama hujatumia mipira. So ukiangalia ni siku ya muhimu sana duniani kwa Wakenya na kwa watu wote ambao wanaishi katika planet of the earth. Maana World AIDS Day, ukimwi, hakuna mtu anasema kwamba nitapata ukimwi. Unapata umejipata na hiyo ugonjwa wa ukimwi, na ukipata na ugonjwa wa ukimwi ni wewe uweze kujizuilia, uweze kufanya mambo ambayo yatafanya uishi vizuri duniani.
Vincent Manzi hapa akitupa tu maoni yake tu kuhusu siku ya leo, ambayo ni siku ambapo tunaidhinisha siku rasmi ama tunaidhinisha siku ya ugonjwa wa ukimwi, ambayo ni tarehe 1 mwezi Disemba, mwezi wa mwisho wa mwaka 2024, na baadhi ya kaunti ambazo humu nchini, ambao ni humu nchini baadhi ya kaunti ambazo pia kuna yale tutasema zile cases za ugonjwa huu. Unazungumzia kaunti ya Kisumu, Nairobi, Homa Bay, Siaya, Migori, Nakuru, Mombasa, Kakamega, baadhi ya kaunti ambazo ziko na ile ambayo tunasema high rate of HIV and AIDS. Kumbuka pia riadha ambayo imekuwa ikiendelea, pia kumekuwa tuna picha ambazo unaziona hapo katika uga wa Nyayo. Barabara tofauti zimeweza kufungwa. Tumeshuhudia barabara ya Pile Road imefungwa, Marathon Road, Ragati Road, Hospital Road, Lusaka Road na Hydrom Road, baadhi ya zile barabara ambazo zimefungwa. Ikumbukwe pia kumekuwa na shughuli tu hizi za marathon ama different races ama kumekuwa na zile tu range of races option, ambapo kama ulikuwa nyumbani, basi kuna wale ambao wameweza kushiriki kwenye mbio za kilomita 10, mbio za kilomita 21, 10 km wheelchair race, 5 kilometers na pia 2 kilometers race. Ukumbuke this marathon theme is promoting the health and well-being of men and boys, and it seeks the main objective also seeks to raise funds to support the rehabilitation of over 26,000 people who inject drugs and at high risk of contracting HIV and AIDS. Remember this, those who have already, those who have AIDS, those who have HIV and AIDS or HIV and AIDS positive. Remember, there's also those who have been affected by the HIV and AIDS, and also kuna wale ambao wako at high risk of being infected by HIV race. The marathon began as early as 6:30 with the wheelchair race event, and followed by the half marathon, which kicked off at 7 a.m. And then we saw CEOs and 10-kilometer race following up closely. Then it's organized by the National Syndemic Disease Control. The marathon has been organized by the National Syndemic Disease Control Council, that is Nsdcc. We also we are also celebrating the resilience and strength and the unity of our community as we lace up this day.
Yeah, and also for Kenyans, you need to know how you should also prevent this HIV. And of course, I mentioned the first one is protecting yourself whenever you're having the intimacy. And of course, to reduce HIV, you need to use condoms. And of course, I mean, you use condom, you protect yourself from those various diseases. And of course, you also need to protect yourself from those injected drugs. So those drugs zenye unapata umedungwa pale, unahakikisha kwamba kama umeenda pale kwa daktari, amekudunga dawa ambayo ameifungua yeye mwenyewe. So if you do this, then you will protect yourself from having the HIV AIDS. And also, you also do this by doing perinatal transmission. So if you do this, you will protect yourself from having this HIV, and of course is prescribed by your doctor throughout pregnancy and childbirth. You know, most of children we have nowadays, they get HIV mostly through this birth, because during the exchange of those bloods, then you can get HIV. So you have to make sure that you protect yourself from having HIV/AIDS by using following those ways, by protecting yourself. Use condoms. Also, do away with anything that can cause harm to your body and that blood contamination. So I think by this, Kenya will have that low rate of HIV/AIDS and will not get featured in those countries that have HIV. And of course, you know, the Southern Africa countries are rated as countries which have high rates of HIV, the likes of Botswana, as I've said, South Africa, the likes of those cities in South Africa. Southern Africa is like they have high rates of HIV. I think Kenya, we are doing good because we are not mentioned in those countries which have HIV. And I think that is the best way that we can do to protect ourselves from this AIDS.
And as the world dunia ikiidhinisha siku hii ya leo ama siku hii ya leo ambayo ni siku ya ukimwi, basi riadha ama Kenya tumeweza kukumbuka Kenya pia ni baadhi ya nchi ambazo zinatambulika sana kwa riadha. Kumbuka ni nyumbani ama it's the home of the world record holder. It's also the home of one of the most well-known marathoners in this world. We're talking about Eliud Kipchoge. And this marathon today is a call. It's a call to action for Kenyans, for everyone back at home, all Kenyans, all people around the globe to join the fight against HIV and AIDS. That's the main objective. The marathon is not just about running, because you know people usually say we are running nation. It's all about running. But today's marathon is not just about running. It's about raising awareness and tackling triple threat. Triple threat. When we are speaking about triple threat, we are speaking about HIV infection, unintended pregnancies, as well as sexual and gender-based violence, that is SGBV. Remember, we're also trying to kick out gender-based violence in our society among adolescents and young people. The marathon is deemed promoting the health and well-being of men and boys, and seeks to raise funds to support the rehabilitation. Kimanzi, shughuli as you can see on your screen there at Nyayo National Stadium, the main event after marathon, there's also another event where people will get a chance to get informed, to get inspired by different speeches or different people who will be speaking during this event as the world. Kimanzi, guzia tu shughuli ya leo pia.
I'm also very happy to see disabled people again in this World AIDS Day Marathon, because you know, those are the kind of people who feel sometimes isolated, and I think this is one way that will give them morale and also to live within the communities, because you know, in this country we have people living with different disabilities. So I think I was very happy to see Tony Kwalanda interviewing some of the disabled people here. And also, it really motivates those people outside there. You know, we have kids who are disabled. So I think when they see their colleagues, they are being interviewed in this marathon, then they will get that energy also to feature in the next marathon that we have. Because in this country, you have different marathons that take place. So I think this is one way of making sure that we give anyone chance to talk and also to showcase their talents. We have different talents in this country. So I think this is one way that will make this country move ahead and also tend to know the hidden talents on those people.
Yeah, we are keeping an eye on what is happening around the globe. We are keeping an eye on what is happening here in the country, more so here in Nairobi at Nyayo National Stadium, where the world today being the World AIDS Day. Today being the World AIDS Day, the national, or rather Nsdcc has organized a World AIDS Day Marathon. Different athletes, elite, amateurs, and even fans have turned out to celebrate this day, have turned out to create awareness, to inform, and even to champion, to end the spread of HIV and to spread the HIV and AIDS, not only in Kenya but around the globe, where this day is being this day is where the world is attaining this day. Remember the 2024 theme. The 2024 theme is take the right path, my health, my right. Take the right path, my health, my health, my right, which emphasizes the importance, emphasizes on the importance of healthcare access and the empowerment of individuals in managing their health. The National Syndemic Disease Control, in partnership with Athletics Kenya, are hosting a marathon, hosting a special marathon event, half marathon event. You know, when people, most people, when most people hear about marathon, they just speak about marathon, but there's different part of different races. We have 21 kilometers. That is an half marathon, and then we have the main marathon that is 42 kilometers. We see some of the main events in 42 kilometers, na nilikuwa na expect hata leo baadhi ya wale ambao wanatajika zaidi, some of the well-known marathoners to come out and even run, but good to see one of the ambassadors there, that is Africa 100 meters record holder, that is Ferdinand Omanyala was there earlier today, spoke with Tony Kwalanda during an interview, and he was saying, watu wanaogopa kupata mimba zaidi kuliko kupata ugonjwa ukimwi, na ni jambo ambalo pia it's a serious case sababu tunajisahau.
I think I will agree with what Ferdinand Omanyala said, because nowadays people tend not to fear HIV, but they fear getting pregnant. But as usual, we expected our very own champions, 3 times Olympic champions. Also, we expected our well-known marathoners to attend, the likes of Faith Kipyegon, the likes of Wanyonyi, and of course Wanyonyi, he did well in the Paris Olympics 2024. I think that was something that they missed, and Kenyans were ready to see them featuring this marathon.
I think they were ready. They are ready for they are waiting for the Chepsaita cross country where they will be taking place this coming Saturday in Chepsaita, and the main theme of that day will be running for education. I think they are getting ready for that.
But of course, you should always be ready, because anytime anything can happen. So if they could have just come, then Kenyans will feel motivated. I am very sure most of Kenyans who came in this marathon and they saw Ferdinand Omanyala just running beside Ferdinand Omanyala will give you that energy. You'll feel that I still can make it in this marathon because I'm just having this competition together with Ferdinand Omanyala. I think even saying hi to Ferdinand Omanyala, that is a big achievement. So if someone could have met Faith Kipyegon, someone could have met even Emmanuel Wanyonyi. Paris Olympics 2024, you saw how he did. So I think that one will even motivate the young ones who are watching live in TV47 and who are following this marathon live in this World AIDS Day.
Speaking of the O's and O's, I remember earlier Tony Kwalanda was speaking, and then he was so excited to see our CEO, that is Cape Media CEO there. So you're talking about people getting excited running close to the most famous guys there. We have also seen the Cabinet Secretary for health there, Deborah Baraza, is also there. Took part in 5 kilometers CEO's race, and we are waiting to see who was emerged winner in that race.
Yeah, of course.
Tony ameiva jina race ya wadosi.
Wadosi pia tunataka kujua nani
ataingia. Ningekuwa pia siko studioni. Pia ningekuwa kwenye hiyo race ya wadosi pia.
Absolutely. I think that one will be motivating. If CEO can run, then who else cannot run? Of course, we have seen them running them. And also I've been following what is happening in the European countries, as also we try to control HIV in this country. So Latvia and also Estonia are the leading countries in those European countries. In Europe, we have a lot of celebrations that happens there. So I think Latvia and Estonia are the countries that are leading with the HIV contaminations, and also people getting HIV. There are many. So they are the leading countries. So I think also I've been watching how Kenyans are very excited to have this World AIDS Day. I think this World AIDS Day is one of the things that really educates people, and not only to educate, but also to know that people living with HIV AIDS cannot be isolated and are also human beings. You have also seen how one of the marathoners there said that he is living with HIV AIDS, and he feels that men are mostly neglected when it comes to this HIV. So I think also you have also given us the data whereby men and boys are the leading with this HIV. I think it's because maybe women are nowadays more aware of this HIV, and that's why they are protecting themselves from getting this HIV, because it's a deadly disease. If you get it, it is a long life disease. So women, it's like they are aware of what is happening nowadays, and that's why the number of HIV infection is getting low to women.
And from here in the studio, my name is Duncan. We are going right away to Nyayo Stadium, where Sheila Chengelangat, one of our reporters, is kambi pale. Tueleze kuna nini ama chukua usukani utueleze zaidi. Sheila.
All right, it is quite an excitement here at the finish line with the over 1,000 athletes who participated in this marathon organized by the Nsdcc here in Nairobi, just as we commemorate the World AIDS Day this 1st of December. And here at this finish line, we do have participants who took part in the race. And if you could just join me, introduce yourself. Na labda utueleze, why did you participate in this particular race?
Thank you so much. So my name is Adrian. I represent Beacon of Hope. We are a facility in Ongata Rongai, and we've been so much into HIV care and treatment. So today it was such an excitement to be able just to join Kenya and join the government in this initiative. First of all, to end World AIDS by 2030. This is a very great initiative, and it's not been easy. Actually, just going through the marathon, it shows how easy it might be outside there, but you now get to understand how these HIV clients actually go through the race daily, each step, making sure that they adhere to medication, that we are moving towards that step, zero new infections, zero new infections to the children, even in the community. So it's not been easy, but yes, it gives us that excitement that even as we go back to support our clients, we now know how hard it is, as much as we might seem very easy to them.
This marathon was actually themed promoting the health and well-being of men and boys. Have the men and boys been left behind?
Yes, actually, all along, it has been, the journey has been end the triple threat. And the triple threat has actually been about the boy child, the girl child. Because when you talk about the triple threat here, we are talking about GBV, zero new infections from mother to child, and also we are talking about zero new pregnancies. So bringing in the aspect of the boy child for us has actually been so good, so influential. We represent Kajiado County, and we know this is actually going to be a new face in the country of Kenya. Yes, and actually even the boy child have actually come out in big numbers, and we are actually happy to support this, and actually we are looking forward to the next edition.
This is the first edition of marathons on World AIDS Day. Would you be willing to join the next one?
Actually, we are actually very much excited to have come for this first edition, and we are actually next coming very much prepared in big numbers, because it's actually a very worthy cause that we're actually participating in for the country and for the clients that we are serving. So I would like to just thank the government and thank even the media for coming in. TV47, this is very great, increasing the coverage and making sure that at the end of the day, Kenya, we are having zero new infections by 2030.
All right, true to our name as TV47, truly we do cover the 47 counties and ensure that we bring you updates as they happen. You participated in the race today. Perhaps what was the experience like, and kukimbia unahisi aje hii sasa?
The experience was quite challenging. Okay, siko expect kama ndamaliza because I was running the 21-kilometer race. Being the first time, I was excited kwa sababu nilifurahia tu kumaliza the race, and ilikuwa amazing. Yeah.
Na mbona uliamua kujitokeza kuja kukimbia leo? Because unajua hii ni World AIDS Day na it is hii marathon ya kucommemorate that day. Mbona uliamua kukuja?
The reason as why niliamua kukuja, niko na friends some wako na AIDS, and nilifurahia hii initiative, and being the first of its kind, niliona ni poa, hiyo ilikuwa imeorganiziwa poa, and nilifurahia.
All right, asante sana kwa kuongea nasi. We also have another lady. Hello, how are you doing? Unaitwa nani? Mbona ulijitokeza kukimbia leo?
Okay, Beatrice Wangoi, and nime-enjoy. We started well, but along the way I didn't have the energy to maintain the pace, but I'm grateful I've managed to finish. We are grateful for this race. It's about the end of triple threat, especially the boy child. Boy Child Hoe. So much has been said, and we are creating awareness. So I'm grateful. Yeah.
All right, thank you very much. Will you join another edition if there will be next year?
Definitely, ndani kabisa.
Okay, thank you so much. There are many participants who are just crossing the finish line and are receiving their certificates. I see you're holding your certificate. You're also having your medal. How are you feeling? What is your name?
I'm feeling great. I'm Polycarp Nyawana. This is a great feeling to finish a race, good race, race against time, running for a cause, boys and men. I'm here represented and representing my boys also. Yes.
You're representing the boys. Do you feel they've been left behind in this fight?
A lot in this fight. A lot of organizations talking about the girl child and women, men and boys. I think this is our time, and that's why I came and did the full race today. I'm so happy. I'm a proud father, and I'm happy for those helping, those living positively, the caregivers. Heko to them, hongera sana.
And unasema you have run the entire course. How was it running?
Oh, it was hectic. I thought it was easy, so I didn't do a lot of preparation in terms of getting jogging and everything. I just walk in. I hope tomorrow, I don't know whether I'll wake up, but it was tiresome. It was tiresome, but I did it with a smile. Yeah, I did it with a smile for a good cause. Yes.
Thank you very much. He did it with a smile, and of course, it is for a worthy cause. There are still more participants. If you could just introduce kwetu, unaitwa nani na mbona ukaamua participate kwa hii race?
Yes, my name is Wycliffe Asevukwa. This is the first HIV and AIDS race. I was encouraged to participate in this race because if you are not affected by HIV, then, as in if you are not infected, then you are affected in one way or another. Yes.
And how would you speak to the experience on the course today? What were the challenges that you faced as you were, participating in that course?
Well, to me, I can say it was not that as challenging, having participated in other previous marathons like Stanchart, Nairobi City, Matahat Run. So I think my body is accustomed to the run.
Your body is accustomed to the runs. Yes. And this run had a particular cause, running in commemoration of the World AIDS Day. And, the theme is promoting the health and well-being of men and boys. When you look at that theme, how do you feel about it?
Well, it's a wonderful theme. So I call upon the boy child to take the lead in fighting against spread of HIV and AIDS. Wanasema chukua control wewe mwenyewe.
Chukua control wewe mwenyewe.
Yeah, and that's what I'm doing.
Okay, thank you for that parting shot. Congratulations for completing today's race, and quite the parting shot that chukua control wewe mwenyewe. Hello, how are you doing? Introduce yourself to us, and why did you participate in this race today?
Okay. Hi, my name is Anne Omolo. I participated in this race today because I run. I basically love running. I do it for health. I do it for fitness. But for this particular one, I appreciate the milestones we've made as a country as far as HIV is concerned, from the time we could not have test kits to test people until a time there's no longer stigma. So there's so much that has been done, and people have begun to accept that, HIV is not a life sentence. So that is why I'm here, and to support other organizations who are actually advocating for the cause for HIV advocacy.
Yes. This year's theme is, it's a race against time. What do you feel about the race that we are running as a country in terms of HIV and AIDS?
Okay, I think every race is not easy. It's hard. I personally practice every other day for this marathon, but every time I run, it's equally difficult. So I think even for World AIDS Day, it's like a race, because it takes a lot. It takes all actors, it takes all private sectors, all individuals to make a change, especially towards achieving our Millennium Development Goals and all that. But as long as there is a will by the people and with the people, we'll make it. And I believe we've come a long way as far as HIV is concerned. Yeah.
And particularly when you speak about your own experience running today, how was the course? How did you feel? Was it challenging a bit?
Today was a bit challenging because we began with a hill towards, especially after the El Celeste roundabout, towards the, towards Ngong Road. So other races usually start by a warm-up. It's usually a bit flat. So by the time you get to climb a hill, your body has already acclimatized, but this one was a bit hard because just when we were starting, the hill was already there waiting. I didn't take time to study the route, so I was really surprised and it caught me off guard. But yeah, I had to finish and I'm glad I achieved.
All right, congratulations. We appreciate you coming out. This is, the 2024 World AIDS Day Marathon in commemoration of this particular day that is always celebrated every 1st of December. And many participants, over 1,000 athletes, came out to participate in this race here in Nairobi, Kenya. And we do have another, participant. You have your certificate, and I see you're a finisher in 10 kilometers. How was it running? Introduce yourself to us, and why did you decide to participate today?
Okay, my names are Cyrus Asivukwa. I did participate in this race, 10-kilometer race one, and I am happy to have finished the race. I love running. I have taken this initiative because it helps myself in keeping fit, and I am really happy today because thousands and thousands of Kenyans turned up to participate in this race. Awareness through running is really getting a big support from our fellow countrymen, and I'm happy today because running for such a cause in capping the spread of HIV and making awareness of how dangerous HIV is a very good initiative. So I'm very happy today to have participated in this worthy cause.
And would you participate next time during if there is another edition of this marathon?
Okay, whenever there will be another initiative like this, I will put my name forward to take part in it, because participating in such activities makes yourself fit and in creating awareness to the entire community or society.
Okay, thank you very much for participating and coming out to participate in the Nairobi 2024 World AIDS Day Marathon that was, held here in Nairobi with over 1,000 athletes participating. And here at the finish line, it is quite the excitement as most of these participants get their certificates as well as their medals. We would be standing by to get you more from the finish line, but for now, back to you in studio.
Thank you so much. Shukran sana Sheila Chelangat there, our health reporter, akizungumza pia na baadhi ya wale ambao wameshiriki kwenye michuano ama wameshiriki kwenye mashindano hayo. Kumbuke leo ikiwa ni siku ya leo ikiwa ni siku ambayo tunaidhinisha siku ya ugonjwa wa ukimwi, Kenya imejitokeza ama kumeandaliwa hafla ya mashindano ya mbio katika uwanja wa Nyayo, ambapo wanariadha tajika, ambapo pia watu ambao pia wana ulemavu watu tofauti wamejitokeza wamejitokeza ili kuhakikisha kuwa basi wamepata ama wameweza kueleza, je, umuhimu gani, ni kipi ambacho tunapaswa kufanya kuweza kujiepusha na ugonjwa huu wa ukimwi, ni kipi ambacho tunapaswa kufanya kuhakikisha kuwa ifikapo mwaka 2030 basi hakutakuwa na kisa chochote cha ugonjwa huu. Lengo pia ama baadhi ya kauli mbiu basi pia zikilenga vijana so wavulana na wanaume ambao pia ambao pia wako kwenye hatari kubwa ya kuambukizwa ugonjwa huu. Na tukizungumzia baadhi ya zile statistics, basi mtazamaji, baadhi ya zile statistics ambazo zimeweza kuandaliwa humu nchini, basi here in Kenya it is estimated that there are 1.6 million people who are currently living with HIV and AIDS. Here in Kenya, it is estimated that 1.6 million people are living with HIV and 1.1 million children who are orphaned due to HIV. Remember, they say that you are infected or you are affected. Sijui ukiwa nyumbani unazungumziaje? Kusema people 1.1 million people are orphaned due to HIV. Inamaanisha kuwa their parents passed away as a cause of HIV and AIDS. As a whole, more than 6% of the population is infected with HIV here in the country. More than 6% of population in the country is infected with HIV, but the pandemic is imegonga different regions and vulnerable group much serious. Kuna zile maeneo tofauti ambazo pia zimeguzwa sana, ambazo zimeathirika sana na ugonjwa huu. Kuna zile maeneo ambapo watoto basi wazazi wao wameweza kuaga na wameweza kuathirika. Picha za zamani pale tukiona wanariadha tofauti wakikimbia katika barabara tofauti katika eneo ama katika jiji kuu la Nairobi, ambapo washindi tayari tumeweza kuona ama tumeweza kujua washindi. Baadhi ya wale ambao wameweza kutoa ushindi kwenye ama baadhi ya wale ambao wameweza kushindana kwenye mashindano yao tumeweza kujua washindi. Pia kutakuwa na hafla ambapo watu watazungumza, watu watakuwa na ile conversation waweze kuelimishana kuhusu ugonjwa huu. Je, ni kipi ambacho unapaswa kukifanya? Ni kipi ambacho unapaswa kukifanya ili kuweza kujiepusha na ugonjwa huu? Wanahabari wetu wamekita kambi katika eneo hilo ama jijini Nairobi, basi wakitueleza ni kipi kinachipuka katika maeneo hayo. Tony Kwalanda yuko huko, tumeweza kumwona Sheila Chelangat akiwa pia akizungumza na baadhi ya wale ambao wameweza kushiriki kwenye mashindano hayo. Pia studioni tunaye Boniface Kimanzi ambaye pia anamsaidia kudadisi siku hii ya ugonjwa, ambapo pia tunakueleza pia kwa undani. Je, ni kipi wewe ni kipi ambacho unafanya? Je, ni kipi kinachipuka na ni kipi ambacho ukiwa nyumbani basi unapaswa kufanya ili kuhakikisha kuwa unajiepusha? Boniface, unalipi?
Just to add on how this day is very important, because we are creating awareness to Kenyans so that they can know that this is a disease that exists in this country, and if we do ways so that we can prevent it. I think, as you have said, that we are affected either directly or indirectly. So I think we have some of the people who have lost their lives due to the HIV, and also others have lost their family members because of the HIV. So I think this day will just give them that awareness that this disease still exists, and also they should also take care wherever they are. And of course, you have seen, we have seen these counties, some of the counties, some of the regions in this country have high rates of HIV, the likes of Kisumu, Siaya, Mombasa. Those are some of the regions that have high rates of HIV.
Okay, let's cross over to Nyayo National Stadium, where reporter, well-informed reporter Tony Kwalanda is there. Tony, tuko na nini kutoka huko?
Yes. Kabisa Duncan, ulivyosema mambo yamechacha. Unajua kwamba sasa hivi mbio zote kwa sasa zimeshakamilika. Kulikuwa na mbio za mita za kilomita 21, mbio za kilomita 10, kilomita 5, kilomita 2, zote zimekamilika kwa sasa, na najua waandalizi kwa sasa hivi wanafanya ile inaitwa vipi, the final tally ya kuhakikisha results ziko verified, ndio kisha baadaye watakuwa wanatangaza mshindi in a few. Lakini kwa sasa I'm just running through what is happening here. Unajua wakati kuna events kama hizi, kuna mambo ambayo inafanyika hapa. There are several of this kind of setups. Wale ambao wamekuja kufanya shughuli kadhaa, for example, they are selling their wares, they are selling their mambo mbili tatu. Kumbuka ni World AIDS Day, na kuna wale mambo hapa hivi wale wauzaji ama wale vendors ambao wamekuja kuweza kuuzia wale wanariadha ama wale mashabiki ambao wameweza kujitokeza. Kwa hiyo nataka niwauliza mbili tatu, wanafanya nini hapa, ni nini hasa wanauza hapa, na inahusika vipi na mambo ya World AIDS Day. TV47 hapa, naitwa Tony Kwalanda, muko live. We are being watched by over 6 million right now kwenye mitandao. Tuambie jina lako and what you do here and why you are doing it here.
Hi, so my name is Nina Saidi. I'm a member of Florix Club Initiative. We are here to not only tell you what we do, but to show you our merchandise. We have several. We have soap, we have body wash, we have detergents, we also have artifacts here. And Florix Club Initiative is a CBO based in Mathare that aims at helping youth in Mathare with talent, whoever has talent. We pass our messages through talent activities, so acting, dancing, spoken words, all that. We are also a branch of AH Kenya, and it was founded through the AYP program, of which the AYP program is the AYP program is a program aimed at helping the youth within AHF Kenya through nurturing their talents, educating them from various aspects of life. Yes.
Well done. Keep up doing that. Congratulations. Nashukuru sana. Mpige shughuli, sisi tapiga tu mambo yenu kwenye TV. Of course, as you can see over us, we have several of these kind of vendors over here. Wacha tu songa karibu. We just show you what's happening over here. They have some lovely Ankaras, some West African touch. This is TV47. Tunasherehekea World AIDS Day Half Marathon hapa hivi. Najua mmekuja kufanya shughuli kadhaa, but of course mmekuja commemorate hii siku. Tueleze jina yako, hapa ni nini ama mnafanya nini?
My name is Leah Wakanyi Maina from the Voice of a Black Child. This is a community-based organization. We are located in Githurai, whereby we create awareness, stop stigma. We are dealing with people living with HIV since our CEO is our mentor. She's Cleopatra Wanjiko. You can follow her on TikTok, on YouTube, akona page huko pia. And even we stop stigmatization in our community. This is where we get the source from to help people. We do distribute pads, condom there, PrEP, and this is where we get our source from, paying our offices, and we do volunteer there. And we have been doing some community work there, and we are happy for this day. And I celebrate our CEO, our Mdosi Cleopatra Wanjiko. She's our mentor since today is World AIDS Day. Hakuitikia kunyamaza, alijiongea so that anaweza mentor wale wengine, and we are happy for her.
Mnafanya kazi nzuri sana, endeleeni sana. Sisi kazi yetu tunaweka kwenye mitandao and do a wonderful job. TV47, keep on doing what you do. And of course, we're just walking through Duncan, through the kind of initiatives they're doing, and these initiatives are very the reason why these initiatives are happening over here, they have a cause to it. Si ati wamekuja tu kufanya biashara, lakini kuna sababu ni kwa nini wanafanya hii shughuli. So let me speak to one of them. Ningependa kuongea na nani hapa? Tuongee nawe, si ndio? Tell us what this is, who are you, in organization gani, ama mnauza nini, ama mnafanya nini? Na of course mnajua tunasherehekea World AIDS Day, si ndio?
Okay. Hii ni kampuni ya Pepsi. Pepsi ni kampuni ya soda. Tuko na soda za Pepsi, Mirinda, Mountain Dew, 7up, Green Apples.
Message yako ya World AIDS Day ni gani? Of course najua umekuja kusherehekea pia hiyo. Siko na ruka story ya World AIDS Day.
Watu wapime health yao, wajue venye health yao iko, na pia mjue
alafu pia unajua pia leo watu wamepata kazi, si ndio? As in such kind of ventures besides just watu wana run, kuna pia ni employment opportunities, si ndio?
Yeah. So huku kama ukikuja Pepsi sahii, kama unatafuta kazi pia unaweza pata kama kijana. Karibuni.
Ndio watu waache kushughuli za kuwa idol, wajiingize kwa mambo mengi. Thank you so much. Nilikupiga shughuli yenu. Asante sana. Soda nitakunywa saa ile nimepiga shughuli. Asante. We are live of course on TV7. Just showing you some of the vendors around here at Nyayo National Stadium who have pitched camp. Remember, during this kind of events, usikae tu home. If you cannot run, if you cannot do anything else, there's an opportunity for you, an employment opportunity. Biashara ziko huku, kuna hustlers bazaar hapa hivi. And of course hapa niko na dadangu hapa. Tueleze your name, what you're doing over here, kwa nini uko hapa, and of course remember we are celebrating World AIDS Half Marathon Day.
Okay, I'm Liana Jones from Mathare HF, and here we are selling our beads. We are making detergents. On the other side, we've been making string arts, wall decors, yes. So we are using all this to pass information to youths and to everyone all over the world, because it's World AIDS Day. So we are fighting AIDS also. We need by 2030, there's no AIDS stigmatization, there's no AIDS at all, and for the better.
Asante sana. Endeleeni kabisa, mnapiga shughuli nzuri. Tunapenda ile kazi ambayo mnafanya ili kusensitize, about the create awareness about HIV and AIDS. Of course, keep on, as I've told you, hapa kuna a lot of vendors doing different things, and of course they have a cause. They are here to really commemorate the World AIDS Day that is celebrated globally. And here we have a half marathon. Tushakimbia sisi, sasa wanatulia hapa hivi. Let me just of course engage her. Utuambie majina yako na unafanya nini hapa na ni nini of course, and why you are here to celebrate the World AIDS Day.
Kwa majina naitwa Isabel Moinde. Tumekuja hapa sababu ya mambo ya Joyful. Ni tuko na group, tumekuja hapa kwa advertise hiyo job, hiyo chama tuko nayo, na hiyo chama inatusaidia sana, ni table banking. Ningealika wa mama watu join. Imefomiwa na bibi ya president. Yes.
Well done. Of course, na message yako kwa during this World AIDS Day. Unaona serikali inajaribu kufanya kila mikakati ili kupunguza maambukizi na pia kuweza kusaidia wale ambao maambukizi.
Serikali imefanya kazi mzuri na tunawashukuru venye wanatufanyia. Wanatueleza mambo ya AIDS, tunajikinga na tunaendelea poa. Yes.
Thank you very much. As you can see clearly. Thank you so much. Endelea na hiyo shughuli, mnafanya kazi nzuri sana. Mama doing good. Vitu moto sana kabisa. Just taking you through what's happening, the ongoings, the biacharas, the initiatives, the projects. Lovely individuals over here who are doing commendable work here at the World AIDS Day Half Marathon 2024 here in the capital Nairobi, here at Nyayo National Stadium. This is TV47. We are just taking through our audience, who you being one of them, about the activities are happening at Nyayo National Stadium. Tell us your name and what is happening here and why.
Okay. All right. Good afternoon, good evening, good morning, wherever you are. My name is Aska Omancha, and welcome to AHF Kenya. Yes, today is World AIDS Day, and today is our day because we are dealing with the whole spectrum of HIV and AIDS. We deal with HIV prevention, HIV treatment, and advocacy. Yes. So today in our stall, we are displaying ourselves, who we are. We are promoting HIV prevention by making sure that we use condom consistently and correctly every time that you have sex. And also we have HIV testing. Today we have our stalls, we have our counselors on site, making sure that we are all tested today. Please don't leave here before being tested. So we encourage that we all test every time. And in case you are tested and you're HIV positive, not to worry. We also have HIV treatment. We have clinics around Nairobi and where AHF is, and we are partnering with the government as well, so that in case you're HIV positive, then there's treatment every time you visit our facilities. And other than that, we have our young people who are displaying what they are, income generating activities. So we are all here today as a full package. Yes.
And of course, we know we are trying to combat HIV and AIDS and ensure that by 2030 we eliminate it. How far are we with that fight, of course, from where you stand?
I cannot say that we have completely achieved, but we have made very, very great progress. At least for now, we have young children not getting HIV and AIDS because we have drugs to prevent the same. And we have made very, 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 very big milestones towards HIV prevention. Yes.
Asante sana. Thank you very much for that insightful information. We appreciate. Keep on doing what you do. We support you there. Asante sana for that. Remember, we are actually engaging here in just trying to find out the vendors, the people who are here, just besides those who are running, those also who are doing vending in terms of different how do you call it, different sectors. Kuna wale wamekuja kufanya biashara, wamekuja kuuza their wares, wamekuja kufanya so many things. So as you can see clearly here, we have a lot of things. Of course, Buju will do certain things. There are certain information materials, booklets, pamphlets. I can see volunteers. Vijana wamekuja, wameamka asubuhi, wamepata shughuli mbili tatu kuweza kujua kunaenda vipi. Buju akiendelea kule. Let me just engage one of them to tell us exactly what's happening here. We have a lot of information about HIV and AIDS. Tell us your name. Which organization is this? What you are doing here? What is all these things? And of course, when we are celebrating World AIDS Day, what does it mean to you?
My name is Aurelia. I work with and for Positive Young Women Voices, a community-based organization in Dandora area, Nairobi. So we usually work with adolescent girls and young women in the diversity that includes young women living with HIV. Hence the reason why we are here today. With us are infographics on ending GBV, because we also program around gender-based violence. So we have some posters on Febicide and also some other IC materials detailing what violence is, forms of violence and response. We also have some case studies for a project that we're working on in it, we lead. So basically in a compiled experiences of young women living with HIV and trying to improve their SRHR outcomes through advocacy and also gaining public support. On the other side, we have games. These are mostly games that are tailored towards kickstarting conversations around sexual and reproductive health for adolescent girls and young women. So they're age-based and they're meant to help them share their lived experiences and also help us address some of the challenges that they may be facing whenever they come up during our sessions. Yeah.
Well done. As you can see clearly, I mean, watu wako na kazi, watu wanachipa works. Ukisema ukikaa home, ukisema ati hauna job, hauna kitu ya kufanya, watu wanapiga shughuli hapa hivi. And of course they're getting, either they are volunteers or not, or whether they're doing it whether for free or not, but they're getting that experience. And of course they are part of the measures that the government is taking to combat and of course prevent the transmission of HIV and AIDS, and by 2030 to finish this particular HIV. So of course I have a lovely lady over here, and she has some lovely artifacts, and I just like to engage her and find out exactly what are these, her name, what she's doing here and why she's doing here. She's lovely art.
So, yes, hello, my name is Pauline Wanja. I work with most at-risk young mothers and teenage girls living with HIV initiative, where majorly we work to empower adolescent girls and young women. And you can see the type of empowerment that is presenting itself, away from engaging them in education, civic education, plus information about SRHR and being awareness creation on matters concerning HIV, GBV. We also empower them economically. So this is part of our girls' work. And majorly we try to make them be strong enough to be able to go out there and do things themselves. Being infected is not the end of the world. And as this year's theme, Take the Right Path, this is part of what we trying to communicate. It's part of their right to be able to get their basic needs. Hence, they can push forward to be able to get what they want. Yes.
Well done.
Moyote.
Asante sana. Congratulations, Moyote. You're based where again?
We are based in Kariobangi. We are a PBO organization based in Kariobangi, working around Kenya to empower adolescent girls and young women. Yeah.
Lovely venture. Thank you very much, my dear Moyote. Of course, in Kariobangi, doing that. As you can see, they are putting their hands into very important and beneficial work. And as we just keep on, definitely, nimewambia leo, as in leo na kuonyesha, si mambo tu na marathon peke yake. Pia watu wanapiga marathon ya wax, wanapiga marathon ya shughuli. Hapa kwenye World AIDS Day Half Marathon 2024, the inaugural marathon ever to be, held in the capital Nairobi, and of course in this Africa. Habari zenyu, mtuambie jina yenyu ama yenyu, na mtuambie ni mnafanya nini hapa, mnatoka organization gani, na of course message gani mnajaribu kupass during this World AIDS Day 2024.
I'm Lillian Ochieng from Rural Women Action on Street Health, and we are here today to advertise whatever we do. We promote whatever we do. We do bags for the rural girls and women, as you can see. Yeah, as you can see, we are doing these bags. Like I teach the rural girls on how to do it, plus the leadership thing. We are trying to reduce the number of new HIV infections in the rural areas, and also we are trying to engage men and the boys we don't want just to be a women-led organization, but we also want to include boys on whatever we do. Yes.
That's very important. Of course, that's actually the theme this year, whereby, of course, all the funds raised by World AIDS Day, they're going for the boys and men who are funza yo maneno. Keep on what you're doing, of course. Where are you based exactly? Or
we are based in western part of Kenya, that is in Kakamega, Msanda. You can out vibaya sana. Karibuni. So we have our social media pages. We have Facebook, Instagram, Twitter. You can reach us there. From Instagram, you find us at r.w.a.s.h and on Facebook, you find us at Rural Women Action on Street Health on Facebook, and you can also give us a call or you send us an email.
Thank you.
Yes.
You're doing a good job. Keep up doing that. We support you like we are doing right now. Asante sana. We are here at the World AIDS Day 2024 here at the Nyayo National Stadium. I'm just running through to show you the vendors, the activities that are happening at this other section. Wale ambao wajakimbia lakini wamekuja kupiga biashara ambayo of course they have a cause behind it. Tunapata ni organization ambayo inasaidia watu mtaani, mavijana mtaani. Of course hata niende kuengage mama hapa hivi atuambie karibu TV47 tuko live. Of course, if you want to share, tell us your name, what is this about, and why are you here during this World AIDS Day?
Okay, first of all, we have REN. We are supporting the cause through the organization known as WAFAC, Women Fighting AIDS in Kenya, and it's basically about touching the lives of people living with HIV through economic empowerment programs, advocacy, education, health, and psychosocial support. So this is one of the things that we do through supporting the women living with HIV, or rather our beneficiaries, or rather, through economic empowerment programs. So these are their wares. They are displayed today. And also we have a book written by our founder. Yes. Yeah, sure.
Thank you very much. Keep on doing this. These are very important projects, and of course you are doing it for a cause. Tutaendelea kusupport, mnafanya kazi nzuri sana. Tunaendelea tu kuzidi kuweza kuonyesha what is happening, and of course the reason why they are here. They're here to celebrate or commemorate the World AIDS Day 2024 half marathon. Wamekimbia. Most of them have actually ran early in the morning, then came and did biashara. What will be your excuse at home? Your name and of course what you're doing over here and the reason why.
I'm Crystal. I'm a fashion designer, and this is Swiss for Smart Widows, yes, and orphans. We do this to support widows and orphans. Yeah.
Where are you based, Swiss? When did you start? Why?
We are based in Umoja. We started for the support, obviously, and just that mostly.
So what exactly is on offer here today? And of course,
we have bags, tote bags. We have fireless cookers. They keep food warm. And we have this beautiful Ankara bags. Yeah.
And they were done by someone within your Swiss and stuff. Who are they? Where are they? I mean, you need to name them and recognize them.
I'm one of them. I made these ones. Yeah.
Thank you very much. Keep on doing what you're doing, of course, and for a very worthy cause. Asante sana. Remember, of course, the World Half Marathon. That's the World AIDS Day Half Marathon here at the Nyayo National Stadium. We're live here on TV47. We've been here since 6 a.m. Of course, we're showing you the vendors who are also supporting the cause. How are you?
I am well. How are you?
I'm very well. Please share your name and tell us why you are here. What is all this thing about?
All right. My name is Lisa Marianne, and I'm the head of programs at Y Plus Kenya. We are the network of young people living with and affected by HIV in Kenya. And what we do is we empower young people to take care of their health, not just physical health, but also mental health. And we also incorporate other empowerment opportunities, such as livelihood opportunities, so that young people living with and affected by HIV can thrive. We are the youth docket of NEFAC, and if you allow me, I'd let my colleagues speak about NEFAC.
Yes, please.
Hi, my name is Nancy Uma. I work at NEFAC, which means the National Empowerment of People Living with HIV and AIDS, affected by TB and malaria too. Mostly we do this by uniting people
through the CBOs, NGOs, and support groups. And our vision mostly is the healthy to provide healthy communities.
Thank you very much. Asanteni sana. Keep on, unless kuna kitu nimesahau moja ambayo yes.
So today being the World AIDS Day, we are mostly focusing on the meaningful engagement of adolescent boys and young men, and the message that we'd want to share out there. Most families are being led by men or boys, so it's important that they take charge of their health, they take charge of their bodies, and in summary, when they do this, we'll be able to have more healthy communities. History has it that it's mostly women and children who are encouraged to take care of their health. But this time around, we want men and boys to lead when it comes to healthcare, but also when it comes to ending HIV and AIDS in Kenya.
Thank you very much. Indeed, well done. Keep on doing what you do. Good job. We appreciate that. Asante sana for your time. World AIDS Day Half Marathon 2024, right here at the Nyayo National Stadium in the capital, Nairobi. Watu wamepiga tizi, wameenda 2 kilometers, wamekuja kupiga hustle. Karibu sana. Tell us your name, what this is all about, this organization, and why you are here during the World AIDS Day Half Marathon.
My name is Innocent Kipchirchir. I work at Nsdcc.
Yes.
Yes.
Nilikuwa na CEO wenyu asubuhi ametoka ndede mbio kabisa pale kwa ile mazoezi yetu ya 5 kilometers, 10 kilometers.
Yes, we are running for the boy child.
Yes.
Asante.
And what is happening over here? What is this message, of course, you're telling people when they come here?
So what we have here is a couple of our frameworks. This is our Kenya AIDS strategic framework too. This is our promotion for the boy child well-being of men and boys. What we are currently celebrating here at the World AIDS Day Marathon. Here we have our multi-sectoral HIV prevention acceleration plan for 2023 to 2030. Yes.
Exactly. And of course, I'm sure Nsdcc, if I say Nsdcc, is really doing a lot of work to ensure by 2030 we have actually combated HIV and AIDS. Some of the major strategic ways we are looking forward to.
Yeah, so we have our Kenya strategic framework in place that guides the response in the country running up to 2025. We have even the frequent last question on the HIV. Simple questions, because comprehensive knowledge among young people is still very low. So with this, the young people will be empowered so that they avoid risk behavior that can put them at risk of HIV infection.
Yeah. Thank you very much. Well done on that, of course. I know these materials are very important. We have to put all the boys yes.
Condoms.
Yes.
Key for HIV prevention. Those who can't abstain, we emphasize them to consistently and correctly use condoms. Yes.
Very important. I mean, if you cannot abstain, kama damu yako ni moto, kama pasi, tumia mpira. Na si mpira soka, tumia condom. Of course, we're here celebrating and commemorating the 2024 World AIDS Day Half Marathon here in the capital Nairobi, Nyayo National Stadium. Already, the races are complete. I'm just taking you through the side shows. Mambo inafanyika kando kando, hapa mbili, tukule tatu. Of course, I have my very good friend over here. Ulikimbia, ama ukukimbia, tell us your name, what you are doing, and why you are here for the World AIDS Day.
So my name is Victor. I'm from Alpha Medical Manufacturers Limited. Today we are exhibitors. We are marketing King's condom. Yeah. So today.
Why Kings, not Queens?
Kings because we are the kings of condoms.
Okay.
We are working with Mr. Stanley, the official promoter of Kings of Condoms. Yeah. Yeah.
Exactly. So far, how many have you engaged, and what is the response? In terms of course, World AIDS, we are fighting World AIDS.
So our approach, as you see, King's Condoms, it comes in a pack of 144 pieces. So the traditional approach is this one. But for us, we want to make the condom affordable in the market. So we want anyone who can go to a kiosk and get a condom that's readily available. So if you want a condom, you can get a 1 piece, you can get 2 pieces, depends on the quantity you want.
I'll come for my stock. Asante sana. Because remember here, we are here of course at some of the vendors here at the World AIDS Day Half Marathon here at the Nyayo National Stadium. We've taken you through those who are doing businesses, those who are doing informational sort of engagements, those who are doing a lot of handcraft supporting causes in the community. Now we are here. Habari zenyu. Tuko live TV 47. Remember, we are one of the sponsors for the World AIDS Day today. And of course, we are happy that you're here. We would like to ask you what's happening over here, why you are here, what is all this about, and why also you are here for the World AIDS Day.
Well, thank you so much. Untold works with people living with HIV and AIDS, and we are a community organization. We support people to live a life beyond HIV, and through that, we embrace them and equip them so that they can live like any other person and accomplish their goals, their dreams, and they don't have anything to limit them. So one of the things that we do is giving them spiritual hope, giving them physical wellness by supporting them in their medical bills, and also empowering them. Actually, these are made by clients, so we give them the skills so that when they go out of our program, they're able to start their own businesses, support their families, and they can live a life beyond HIV and AIDS.
And where are you, of course? Where are you situated? Where can you be found? How can people access you?
So our offices are in Rimuru, our headquarters, but we have 30 centers in Nairobi. We are as far as Thika, we are in Mlolongo, we are in Kawangware, Ziwani. So we have 30 centers in different parts of this Nairobi.
Thank you very much for your time. Keep on doing that. Definitely at TV 47, we are excited that you're here. Asante sana. As of course, clearly told you, just taking you through, mambo mbili, ma vendors wako hapa wamekita, some of the partners, the sponsors who are here to commemorate the World AIDS Day Half Marathon 2024. Hapa tumekuja kwa wale wana kutest kuweza kujua kama wewe unaweza mbili tatu information about your health. Welcome to TV 47. We are live. We are just getting through all the vendors who are doing the different initiatives.
And boys' well-being and health. Have they been forgotten, and perhaps what are these interventions that you're coming up with?
Yes, we cannot say really forgotten. It is just that what happens with the men, they are the sole breadwinners, so they may leave home early and come back late. So at times, capturing them may be difficult. And so there is need for interventions, to show that we have friendly clinics that are addressing the men, and also friendly ones for the young people and the adolescents, as well as for the children. And so those are the interventions we look into, so that we have improved coverage and so that we are leaving no one behind.
And the goal by 2030 is to eliminate HIV as a public health risk. Are there targets that we've met, and will we really get to 2030 where we eliminate HIV as a public threat in Kenya?
Absolutely, we can eliminate. So right now it's 98, 97, 96. That's what we've been able to achieve. We've had a tremendous reduction in mother-to-child transmission, and I believe we can do much, much more. So again, with the support from our partners, we have PEPFAR, we have UNAIDS, we have a UN representative here, and again, the implementing partners. It's all about collaborating and synergizing, and also complementing whatever the ministry and whatever the government has agreed, that is universal health coverage. So how do we integrate the HIV programs into the UHC program?
Right, asante sana, Madam Waziri. That has been the CS Health Dr. Deborah Barasa speaking to us about, the situation, the HIV situation in Kenya, and some of the gains that have been made in Kenya. She has just mentioned that there are ongoing interventions to ensure that the man, the boys, and the children are not forgotten in this race to end HIV as a public health risk by the year 2030. So from here, the CS will be heading to the stands that have been exhibited here at this particular stadium, and then we will have the official celebration of the World AIDS Day 2024 commemorated here in Kenya. And this has been the first marathon that has been held in Kenya as we commemorate the World AIDS Day that is normally done on the 1st of December. And there have been many participants, over 1,000 athletes who have come out to join in this fight, as themed that it is a race against time, as well as it is time to promote the health and well-being of men and boys. So for now, I hand you over to studio, as now we see the CS Deborah Barasa attend some of these exhibitions.
Offering them prevention services and other core interventions that empower them to be able to negotiate for safe practices and that they remain negative.
Yeah. Keep on doing what you do. We'll support you indeed. There's so many vendors over here going on and stuff of that. Of course, vendors who are engaging, and of course, they're doing the engagements with some of the populace, the people who are here. Of course, these are some of the vendors who, definitely the people who come here, the athletes, the runners, the boys and girls who indeed need such kind of information, because most people find it difficult to get information about AIDS and of course any other information. So here they have plenty of materials and interaction with the experts who are giving them information about AIDS. Habari za karibu TV 47, naitwa Tony Kwalanda. Ningependa kuwauliza hapa mnafanya kazi gani, mnaongea na kila nani na ni kwa nini during this World AIDS Day?
Okay, karibuni sana. My name is Betty Chepkwony. This stand belongs to NASCOP. NASCOP, of course, is mandated to carry we are mandated to spearhead HIV testing, HIV in the country. Now, today here, we are more of giving information. And of course, we are giving out some few merchandise. We are giving information in terms of prevention, care and treatment, and also the youth. We are also giving the youth information in terms of how to prevent themselves. So mostly today we are just giving out what you're seeing here, the OraQuick. OraQuick is self-test kits. We are just giving those who request for the test kits to go test at their own space. Since it is a self-test kit, it's not a must that they test here. They just carry. You can see we also have condoms here. We have some few things telling us about the World AIDS Day. In fact, we are all together.
As you prioritize young people.
Are they free?
Yes. For the purposes of today, we are giving them out and giving a priority to young people, considering this year's theme is focusing on young men and boys. The young people are the most infected. If you look at the data, the infection rate is at 41%. Okay, thank you.
Of course, thank you very much. That is NASCOP right there. Of course, they have been told, of course, we are getting the self-testing kits. And I understand, of course, right now we also have, as you can see clearly here, we have the CS for health. Of course, clearly we have our colleagues over there, CS of health, that is engaging some of the vendors who are here, being informed, of course, what's going on, together with the Director of Health, Pat Kamau, the CEO of the National Syndemic. As you can see, it's a beehive of activities. Clearly, where there is power, you'll find a host of and many people who are coming there. So remember, we are live here, TV 47, to bring you every inch of every information of what is happening on the course and off the course. So kwa sasa, wacha tuzunguke kwa sasa. We shall just be walking a bit. And of course, my cameraman, of course, can walk with the camera ahead to we are going to one section where there are people, Maybet, one of the sponsors of this event. Mimi natembea tu, mimi nitaruhusu. Buju leo uko na mimi. I'm just taking you through a run, and people are really engaging in terms of information, their refreshments. Mambo ni moto hapa Nyayo National Stadium. You've just had yourselves, of course, you can come here, get yourself a self-testing kit. When you're home, would you test? Would you status yako? Ni very important to know
has been Tony Kwalanda having a chit chat with some of the vendors who are there, as they are telling him what they are doing, what they are selling, and why they have attended this day. As the world commemorates the World AIDS Day 2024 here in Nairobi. We are commemorating it in style. Nsdcc World AIDS in style, because the Nsdcc has organized a World AIDS Day half marathon. The marathon or the events of the races have already ended, and just to give you brief results of what happened earlier today in the races, where Shadrach Gumbao, he's the winner of the men's 10K or 10 kilometers, with Shadrach Kipyegon coming second. And remember, those who have won in the 10 kilometers bagged home 100,000, or the winner has bagged home 100,000 Kenya shilling, whereas the silver medalist has gone home with 70,000 Kenya shillings. Somewhere elsewhere, Gladys Kwamboka has won the women's 10-kilometer race in the 2024 World AIDS Day half marathon, and she has bagged home 100,000 Kenya shillings, whereas Diana Wanza is the silver medalist in the women's 10,000 kilometers race. Elsewhere, we have seen Jonathan Samanayo winning the 21 kilometer at the 2024 World AIDS Day half marathon, where Viola Chepngeno is the winner of the 21 kilometer, and that is in the ladies category. Rael Accord has bagged silver medal in the women's 10-kilometer wheelchair race, and Kiambu-based Caroline Wanjira from Kiambu is the winner of the 10-kilometer wheelchair races. The races have already ended, but there's a lot of events that are going on. Whether you are just joining us, this is TV 47. We are coming live from Nyayo National Stadium, where there's an event that marks, the world is commemorating the World AIDS Day 2024, and we have just seen different athletes showing up, running. Remember, the event is all about showing the world that Kenya is united in the fight. So, guys, is united and in this fight against HIV and AIDS. Now the journey ahead, we are miles ahead. Today's theme, or this year's theme, is "Take the Right Path, My Health, My Right." My health, my right. Take the right path, my health, my right. And also, speaking of the marathon, as I stated earlier, it has been organized by National Syndemic Disease Control Council, NCDC, as a call to action. And the marathon is a call to action for all Kenyans to join the fight against HIV and AIDS. The marathon is not just about running; it's about raising awareness, and tackling the triple threat of the new HIV infections and unintended pregnancies, as well as sexual gender-based violence, that is SGBV, among adolescents and the young people. The marathon also has its own theme, and this year's theme of the marathon, or this being the first edition of Nsdcc World AIDS Day 2024 half marathon. This year's edition theme is promoting the health and well-being of men and boys, and it seeks to raise awareness. It seeks to raise funds to support the rehabilitation of over 26,000 people who inject themselves and at high risk of contracting HIV and AIDS. I understand Tony Kwalanda again is on the ground, keeping an eye, giving us update. Tony Kwalanda, what's happening? Tony? We will be joined later on by Tony Kolanda. Apologies for that. And I was telling you about this year's marathon theme. As you can see there, there's a live event at Nyayo National Stadium. You can see some of the chiefs. I think some of the chiefs there. Tony Kolanda.
We are live here at Nyayo National Stadium. Of course, we're engaging the vendors, some of the sponsors, big sponsors of the World AIDS Day 2024 half marathon here at the Nyayo National Stadium. And one of them is, of course, marafiki zetu Maybets. Wamekuja. And see, it's just not only that, they're not coming, of course, to share information about Maybets, but they are part and parcel of the efforts that the government is putting in place to combat HIV and AIDS. You can imagine the amount of money that are put into the sponsorship of this particular event goes a long way. Remember, they're raising funds to combat HIV and AIDS, especially in men and boys. So niko na rafiki yangu kutoka Maybets, anaitwa Chris mwenyewe. Chris, your place is full of activity. What's going on? Tell us, of course, what's happening over here with your team, who are engaging this, the other Kenyans, and why you are here for the World AIDS Day half marathon.
Okay, so first of all, as Maybets, we are proud to be part of this cause, and we are here to support the cause where we want to push against the destigmatization of guys who are affected by HIV, and also we want to also unite Kenyans and play a small role in uniting Kenyans, in uniting the force, in supporting our brothers and sisters. So we are here. We also played a part in the marathon, and also
I know you must have gone jogging or something, and then of course what's happening over here. Tukuja na wewe tu hapo, tuambie nini inaendelea hapa, wanafanya nini hapa hivi, what's going on? Yes, it's very important.
So over here, these are our prospective customers who are interested in our products. Wanataka kujua what Maybets is all about, and us, we stand for your story as CSR, and we want to support our community in the best way that we can. So over here we have our branded merchandise, things like wristbands and all that stuff that can also help to push the brand. But in all, we are here just to support the entire community, Kenyan community, and we thank them for also coming together to support this wonderful cause in uniting Kenyans, and also helping in not only just the stigmatization, but also just coming up with things like supporting in things like medication, and in a very small way. Yes.
And of course, men and boys are being targeted.
Yes.
We've just been focusing mostly on girls and women, but now men and boys actually play a very key role in either stopping it or increasing the transmission of HIV and AIDS.
Yes. Yeah, that is true. And part of the cause, in terms of everybody playing a key role, is also assisting in supporting in terms of education, so that people can understand preventive measures, and also just taking care of themselves, going for tests and all that, and also just supporting our youths also in terms of being productive in the society, either through simple things like local football and all that. And Maybets is passionate about helping the community.
And today you've created employment, Chris. Leo umeajiri watu wengi sana kazi as Maybets, in terms even besides supporting this event.
Yes, definitely. Because we are all for growth, right? And we are all Kenyans. So we are extremely happy to play that part and to create that impact in our community. Yes.
Thank you very much, Chris. Keep on doing what you do. Maybets waendelee kupiga shughuli yao. And of course pale mweke zile leo ni siku gani? Leo ni Sunday. Leo kuna game kubwa. Manchester City na Liverpool. Game moto inapigwa leo usiku. Kama umechelewa mzee wangu, usichelewe kuekelea mwekezaji, kula kitu. Wacha tembea pia mbili tatu kuhusiana what's happening over here. Vendors of course who are part of this particular initiative. Karibuni sana TV47 live hapa hivi moja kwa moja. Tumetoka kwenye race, tumekimbia, tumekuja sasa. Watu walikuwa wamekimbia, wamekuja kupata calories, zile energy wamepoteza, wanakula sukari hapa. Tell us what what this is about, your name, unafanya nini hapa na ni kwa nini uko hapa during World AIDS Day.
Hello, this is Anne, Soft Life Bakers. We are located in town and we have a branch at the river. We came here today tusaidie watu wenye wamekimbia wapate nguvu. Sukari inaongeza nguvu.
What's your message in terms of we are trying to reduce the number of infections, tunajaribu kucombat HIV and AIDS by 2030. Wewe kwa maoni yako, message yako kwa wale vijana, kwa wale wazee, kwa wale wasichana ni nini?
Nimesoma on their t-shirt, it's a race against time. It's a race against time. Kwa hivyo vijana, kila mtu tukue in that race. Tuogope, kuna ukimwi is real. Tuogope, to condomize.
Exactly. Yes, weka mpira na ukule keki. Kabisa, of course. Coming to you live here at Nyayo National Stadium, and some of the vendors, some of the sponsors who are here, and of course who are here to display what they are doing, to engage us in terms of exactly what it is they do. So hapa naona kuna Ora Quick HIV testing kit. It's a testing kit. Naona hapa wanafanya 2-3. So of course they're giving out, as you can see clearly, that there is a huge demand in terms of information about this, and they are getting now information from the experts about the oral quick. So wacha niulize, karibu TV47, ningependa mtuambie oral quick test ni nini, tuambie jina yako na ni nini haswa.
Yes, so my name is Gordon Oreng. I work for Mydenis Healthcare, and we are the supplier of this product called OraQuick. This is a self-test kit for HIV. It's a product that is approved by WHO, and we supply all the government facilities through Nsdcc. Yes, so for this kit, you can buy it from the pharmacies around, and when you open it, first you will get the instruction manual is there inside. The instruction manual is written both in Swahili, as you can see, and in English. So when you buy it, you take your time, go through the procedure and use it. And when you open the kit, you'll get all this material inside. This is where we have the swab and the buffer inside. So once you remove the pad from inside, this is exactly what we'll do. You do the swabbing of the upper gum, like this. Turn the other side, swab the lower gum. Then you put it inside the buffer, in that orientation, and wait for the result after 20 minutes. So it uses the oral fluid, not the blood. So yes, so this kit is approved by WHO, and we supply the government facilities.
Thank you very much. That's something I actually even didn't know myself. Now najua information. Asante sana. And of course I can see mumekuwa busy sana. Asante, well done. As you can see clearly, that is what's going on here at they're getting now. There's actually an oral testing kit for HIV. So kama huwezi dungwa shindano, kuna ile ya oral, and I can see there's a demand for that. Hapa sasa ndio nimekuja kutafuta size yangu ya condom. Of course, please tell us your name, which organization you represent, why you are here, and what you're doing here.
Hi, my name is David Ochieng. I work for PS Kenya, and today being the World Condoms Day, we came to showcase like what we want to offer, like what we have been offering, like providing services to the marginalized, making sure that every person and each and every person is able to reach the condom, so that we can at least reduce the rate of HIV and AIDS, and that has been our mission and vision. Yeah.
Thank you very much. Keep on doing what you're doing. Unafanya kazi nzuri. We will fight this particular HIV AIDS mpaka 2030 isikue. Thank you very much. Asante sana. As you can clearly see, we just keep easily just showing you what's happening here. The vendors at the Nyayo National Stadium during this World AIDS Day half marathon. And of course, I've got an opportunity. This is TV47. I hope you welcome us over here. Tell us, of course, your name, your organization you represent, and why you are here during this day.
Yeah, so my name is David Mutinda, and I work for an organization known as Ambath. Ambath is in North Rift, covering 4 counties. covering Uasin Gishu, Trans Nzoia, Marakwet, and West Pokot. We are here to participate in this national event, targeting men and also young men to support in terms of curbing for HIV. When we look at what we do in the counties, we provide care, we provide prevention as well, preventing HIV among different populations in the North Rift part of Kenya. Yes.
Thank you very much. Asante sana kwa kazi nzuri ambayo mnafanya. Of course, as you can see clearly, it's very important. It's you need to condomize. Kama uko sexually active kama mimi na hauna mshikaji ama bibi, tumia mpira. Oh, this is PrEP.
What PrEP does, this is a drug that prevents someone from acquiring HIV. This is pre-exposure. We call it PrEP, is pre-exposure prophylaxis. So this is a drug that is targeting young people and everyone else, actually not just young people, but this is before exposure. And then we have what we call PEP. PEP is after exposure. If someone gets into risk, and they are not very sure about the status of the other person, if you get into risk, then you need to run to the health facility within 72 hours. You are given this drug, then you are protected. You take it for 28 days, and you are well protected. But the one for PrEP, this one you take as long as the risk is there. As long as you think you are at risk, you are good. You are protected.
Thank you for that piece of information. That was very important. Asante sana. We are here, of course, some of the vendors. Of course, I'm being told kuna photo ops. Wanataka kupiga picha na mimi moja kali sana. But of course, there's one there. There's some of the other things.
Yes, please. This is, let me just open it for us to see. Just in a minute. So this is also self-test kit. And the self-test kit, we call it Ora Quick. So the people do not want to go to the health facility for testing. Watu ambao wanaongopa kwenda kujipima, this is the right thing to do. So here you just take it and you sap and you're able to see your results within 20 minutes. In case it is negative, then you know that you're okay. You can continue staying negative. In case you are positive with this one, then you need to go to the nearest health facility. You are confirmed to be true positive, and then you're also linked to care. So this is one of the game changers that we are seeing in this country, because you don't need to go to the health facility for testing. The beauty is things are being revised, and over time we are going to see a lot of, just getting tested, your status, you get into taking PrEP in case you are at risk, and in case you are exposed, then you go and do the PrEP as well. Yes.
Asante sana for that in-depth information. Thank you. Nashukuru sana for that. This, of course, is some of the vendors. Actually, we are tumefika katikati pale tulikuwa, so we shall actually wrap it over here. Tumeshamaliza hiyo shughuli. Ama tunaendelea. So of course, I've taken you through actually almost all the vendors and sponsors who are here at the Nyayo National Stadium just to engage with the runners, the fans, the spectators, and those who need information about HIV and AIDS. And of course, here at TV47, definitely tutaendelea kupigia hii shughuli. And from now, let me hand you back to my colleague. Of course, they are in studio, others are in the main auditorium, others are in the course. So from now, wacha mimi niendelee kupata information, wacha nichukue ma self-test kit, tutakutana ma time.
Tony Kwalanda there. Shukran sana Tony Kwalanda. Kazi safi hapo. Anatuonyesha ni wapi, ni kipi anauza, watu wanafanya nini. Pia tumeweza kuona Maybets pia wako pale, ambapo pia wanalenga pia kuunga mkono ama wameweza kuungana pia na dunia mzima kuidhinisha siku hii, ambapo dunia inaidhinisha siku ya ugonjwa huu wa ukimwi. Na hapa studioni with Boniface Kimanzi. Boniface, shughuli safi, shughuli nzima umeweza kuitazama. Labda uguzie tu mawili matatu.
Kwanza naona vile Tony ameingiliana na wale wa Kenya wamejitokeza pale Nyayo National Stadium, and I'm really happy to see what Kenyans are doing, because that is a big number of people who turned up for this event, and they are doing a good job there. And also how Kenyans are trying to showcase their talents, others are trying to do their work there. These events, you will get money, go there, you sell your things, you sell your bags, you sell your artifacts, and then you get money. So I think I'm so happy for what Kenyans are doing, and for real, this is a big day, and Kenyans are now aware of what you should do so that you can keep yourself safe from this HIV and AIDS. And of course, those who are having HIV, those who are living with HIV AIDS, they should also know what to do so that they can live longer in this life. At the end of the day, we are aiming to live longer in this life because health is the most important thing you should have in this life. And World AIDS Day will give you that information on how to live well in this planet.
And then, as you can see on your screen, this after race event. I think people will be now be informed. There will be inspirational from different inspirational messages from different people's speeches, because we have seen CS there, Cabinet Secretary Deborah Baraza is also there. She's also there. She will be speaking also to people, to the world, telling us she will be speaking to the world later on. This on your screen, it's a post-match race event where people there will be sharing their ideas. People will be giving out messages, creating awareness regarding this dangerous disease, HIV and AIDS, as the world today commemorates the World AIDS Day that is usually celebrated every first day of December. And today is the first day and the first day of December, the first day of the December, the last month of the year 2024. This year's theme, tukizungumzia vijana, wanaume na so wavulana wadogo. Vijana siku hizi kidogo ni kama wana mama wanaume na pia.
Of course, also today is the first day of December. It's the last month of this year 2024. And also as we get into these festive seasons, you know, during the festive seasons is when a lot of things happens, a lot of celebrations happen, and at the end of the day you might find yourself in the wrong hand. But of course, if you are now, I think this is the right day for us to have this World AIDS Day, because we are now getting to the festive season. I was following what is happening in the social media, and now people are celebrating. They are saying now, do we have any problem if we start now getting to these sherehes? So I think now having aware on what is happening in world of AIDS, then you should also take care, protect yourself, and also keep yourself safe as you get into this festive season. So mambo ni mingi ambayo itaendelea katika msimu wa sherehe. December ni mwezi wa sherehe.
Unasema ulipoamka asubuhi uliangalia mtandaoni, watu wakaangalia wakasema ni tarehe moja, ni tarehe tumeingia mwezi Disemba, wakasema sherehe tumeanza. Lakini naambiwa piga sherehe, upige sherehe, ukipiga sherehe basi angalia pia hatari ambazo huwa zinakukumba iwapo utaingia tu kwa sherehe kama umejiachilia. Usijiachilie basi mtazamaji. Kama ni shughuli unapiga pia kuna zile mikakati ambazo unapaswa kutumia. Anasema tumia pia mpira za condom pia.
Pia ukitumia mpira unaweza fanya abstinence. Unaweza kaa bila kufanya mambo kama yale ndio uweze kuwa safe. Nilikuwa naamka na kaangalia pale kwa social media, kwa WhatsApp, kwa Instagram, pale TikTok, Twitter. Ni mwezi wa sherehe. Unajua umeanza official and umeanza on Sunday, on a weekend. So Kenyans are happy, and of course I was doing some of the statistics in those other countries, but specifically in Kenya wanasema sasa ni mwezi wa sherehe. So ukiingia kwa sherehe unajua kwamba kuna ugonjwa wa ukimwi na kuna magonjwa mengine vile vile. Ukijikinga kutokana na ugonjwa wa ukimwi pia uweze kuzuilia kujipata ule magonjwa mengine kama STIs, kuna syphilis, kuna gonorrhea. So I think this is a big day. And now for those who have won, of course they will always keep on remembering this day of the year. First day of the month. Naingia December sasa.
Kwa wale ambao wameshinda, unazungumzia wale ambao wameshinda mbio tofauti?
Kuna wale wameshinda mbio tofauti pia. Ukipata kitita cha pesa kama kile unaweza jiendeleza katika maisha pia.
Kama vile wale ambao wameshinda mbio, ama yule ambaye ameweza kuibuka na ushindi katika mbio za kilomita 10 ameweza kutoa ushindi, ameweza kuelekea nyumbani na kitita cha 100,000. Yule ambaye ameshinda ile ambayo tunasema elite race ambayo ni 21 kilometers ameweza kuelekea nyumbani na kitita cha nusu quarter milioni 250,000. Alafu ule mwanadada kutoka Kiambu ambaye ni Caroline Wanjira ameweza kuelekea nyumbani na kitita cha 100,000 baada ya kushinda ile ambayo tunasema ile ambayo tunasema 10 kilometers women 10 kilometer women wheelchair race. Huyo ni Caroline Wanjira ambaye ameelekea nyumbani na kita hicho. Na mtazamaji, kama ndo unaungana nasi, basi kama ndo unaungana nasi popote ulipo, kama uko nyumbani, kama uko kanisani, ama kama pia uko kwenye matatu ukielekea shughuli zako, hii ni TV47 ambapo tunakuletea hafla hii ambayo hafla hii ya siku ya kuidhinisha siku ya ugonjwa wa ukimwi ambayo inaendelea, ama hafla hii ambayo inaendelea katika uga haswa wa Nyayo pale Nyayo hapa jijini Nairobi. Tumeweza kushuhudia mbio, tumeweza kushuhudia riadha, mbio tofauti ambazo zimeweza kufanyika, pia barabara tofauti ziliweza kufungwa. Na nikija mapema leo around saa 10 asubuhi asubuhi ya leo ilibidi nishukie mbali sana kule, wanasema Valley Road
Valley Road tuko
ikabidi nimetembea. Unajua mimi ni mtu ambaye anatumia matatu kidogo
lakini nafikiri
gari iliharibika.
Nafikiri kuwepo kwa hii siku ya Jumapili, unajua on Sunday in Nairobi CBD we have lesser activities that take place, so I think it's a good day for having this World AIDS Day, and Kenyans are happy, and I'm very sure that we have got information on what to do this day.
Let's cross over to the event, the post-race event. Let's listen to what is happening.
Simama watu wakuone. Huyu chief siku ya maandamano alicontrol, by the way. Huyu alimake sure wase hawajaguzwa. Haya, tano watu waone sura ndio wajue wewe ni Mjaluo na ungepiga watu kwa sababu hata wewe umezoea maandamano. Haya, wacha ni na DCC yako wapi? DCC ndiye mdosi wa hawa wote. DCC yako wapi? Huko umebadilisha? Ala, sawa, ako hapa. Haya, wapi OCPD? Enda alituma watu. Usisimame OCPD, usisimame. Alafu niongee vibaya hivyo, alafu hata mimi nipotee, ni abductiwe. Saa hii uone Jesse, Subaru, kidogo free Jesse online, na mtanisaidia ni online tu. Nipotee, niende nitembezwe, niingizwe Nyayo House. Na huko chini, mnajua huko Nyayo House kuna mahali huko watu walikuwa wanafichwa zamani. Zamani za kale, sio saa hii, zamani. Kuna watu walikuwa wamewekwa huko. Zamani watu walikuwa wanawekwa huko ndani. Saa hii nishikwe, nizungushwe na Subaru, nikidhani niko Naivasha, kumbe bado niko town. Niingizwe ndani ya Nyayo House huko ndani kwa kanyumba kako na giza. Hakuna mtu anaona, na guzaguza hivi unadhani uko peke yako. Jesse ako peke yake, unaenda kukaa kwa kona, unasikia kijana wacha kunikalia. Ala, baba uko hapa? Kesho tuko na wewe. Sinafinywa. Baba alifinywa wakati wa Moi. Sorry guy, nimesema Moi. Watadu. Tutamsalimia. Hakuna kitu watafanya. Wakati wa Moi ilikuwa mbaya. Baba alifinywa. Unajua baba zamani alikuwa anatembea poa sana. Raila alikuwa gamsiana bounce. Akashikwa, akaingizwa Nyayo torture chambers, akafinywa. Ndio sababu sikizi anatembeanga hivi. Don't joke. Hizo enzi zilipita. Saa hii tunatisha watu, mpaka mnatisha president. Yaani nyinyi muliamua, na mimi nasema ya kwamba wewe uongo. Nyinyi danganyi. Hapo naenda hapo ati Ruto must go back to State House. Aya, tuendelee, si ndio? Sasa niko na watu wangu hapa wa nguvu sana, wengine wa maana sana. Kabla CS akuja atuambie mambo ya Taifa Health, sasa niko na watu wa nguvu sana wataperform kwa Color Fest. Najua mnawapenda sana wa Douglas, wako hapa ndani ya nyumba. Uko tayari na wao? Alright, ladies and gentlemen, nataka kuintroduce wase wawasalimie ndio mjue Color Fest tutakuwa pale. Na of course hata DJ Wiwa. Si mmempenda DJ Wiwa? Wapi nduru ya DJ Wiwa wewe? Kuna ma DJ lakini wacha nikwambie, au ma DJ kina Joe Mfalme, sijui kina Cream de la Cream, sijui DJ Daffy. Bro, hawezi kitu dem anafanya. Si wakuja hapa tuambie wa spin na miguu. Hebu DJ Wiwa chuna na mguu asikie. Mama sana wapi nduru wewe? Kwa hivyo DJ Wiwa pia atakuwa pale juu, tutakuwa tuna spin na yeye, tunacheza color face. Mimi siwezi toka na hii t-shirt yangu ikiwa white, nataka ipuliziwe, ipigwe, kila kitu ikue. So acha niite wa Douglas wakuja hapa watugusie ngoma moja, wasiguze sana juu color face bado iko. Ladies and gentlemen, wa Douglas wa anguka nayo. Wa Douglas wako wapi? Wa Douglas.
Ukwanga bado unachukiwa madam, so anguka nao itabaki meflow na vibe. Anguka nao koko single for now. Dagi mteja patikani hadi late night saa 6 ndo taniwai. Nikupi location na kofana na hii sukate call niko chomba ya TV, najua utakuwa release. Hata nikushow kwanza form ya bidon nishashika poa na twende chini kwa chini akiwa hadi na mimi. Sasa tunasikiza City tuna feel free. Take a video na post pale Nsdcc. Jina ni cancel kurap city talent. Anguka nayo. Anguka nayo. Check it. Anguka nayo. Twende down low now. Sasa pulia mikono juu alafu click. Uliza pesa alafu one leg. Anguka nayo. One leg. Anguka nayo. Anguka nayo. Anguka nayo. Anguka nayo. Anguka nayo kama uko na new cast. Anguka nayo kuna pati na maboss. Anguka nayo round tuko hii bus. Anguka nayo ati, anguka nayo ati, anguka nayo. Anguka nayo. Anguka nayo. Anguka nayo. Na katika msupa ebanjuka. Cheza chini kukonezo matuta. Anguka nayo baby girl ushaijika. Dagi matisho za wadaki. Ama dali, tabu serikali. Juni serikali, tamka asali. Tunajua ni nani, flow mshati. Tumebunga hapo down ni chi. Wawe Kutekiwa kwa daily B Mana Deba Anguka nayo. 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 Super messy relax. Anguka nayo kama kuna new cast. Anguka nayo kona pati na magosa. Anguka nayo round tu kwa hiva. Anguka nayo. Anguka nayo. Anguka nayo. Anguka nayo. Anguka nayo. Anguka nayo. Anguka nayo kama kuna new cast. Anguka nayo kona pati na magosa. Anguka nayo round tu kwa hiva. Anguka nayo ati, anguka nayo ati, anguka nayo. Anguka nayo. Anguka nayo. Anguka nayo. Shakia. Natumshakia. Natumshakia ni wada. Ni wada. Ni wada. Hello.
Wapi nduru ya wa Douglas? Mimi sitaki waimbe ngoma ingine. Juu kuna color fest. Unaona hizi tisho zenu za white, tunataka ziende zikiwa za marangi. Ama naaje? Tunapiga hapo color fest, itaweza sana. Wa Douglas watakuwa naogopa hata kuwakaribia. Wanakaa kupiga mtu ngeta.
Sorry.
Kwanza huyu wewe ulipiga watu siku ya maandamano. Kuanguka nayo kabisa. Wapi nduru ya wa Douglas wewe? So tunapiga color face pale, sitaki hii ilikuwa ya kuwagusia tu ndio watu wajue bado wa Douglas wako hapa hivi. Nimezichukua kabla zipotee. Wewe niambie kukutana nao watu jioni. Unaweza dhani ni musicians ama hao wengine. Unakimbia. Lakini hata na wako na pesa na hawavai ka King Kaka. Lakini King Kaka pia alikuwa anavaa hivyo kitambo. Mungu akamuokoa akamtoa Kaloleni. Akafika hapa. Mungu ni mwema. King Kaka, sasa unaona hawa sasa unaanza kusikia vile ulikuanga. I hope phone yangu bado iko. Kabisa. Na sasa nikuulize wewe sign language. Yes. Hao watu walikuwa wanafanya anguka nayo. Mbona haukufanya? Haya, nataka ufanye hivyo vile walikuwa wanafanya. Anguka nayo, one lege. Anguka nayo, one. Hiyo ni mapanga le. Usi confuse hawa watu. Usi confuse hawa watu. Haya, anguka nayo, one lege. Anguka nayo, one lege. Anguka nayo, one lege. Mapanga le. Wewe. So una translate hata jokes zangu. Haya. Wacha nione translate. Raila Odinga baba. Wanajua huyo ni Raila. Haya. Baba ni hapa, si ndio? Baba ni hapa. Sakaja. Oh, Mandonye. Aya. Sakaja ni Mandonye. Aya. Sakaja. Babu Owino. Hiyo haina. Oh, Babu. Okay. MC Jesse. Hii kuongea sana. Hii kuongea sana. Okay. Kithure Kindiki. Na usiweke soprano. Gachagua. Kindiki ni? Analala. Analala sana. Kindiki. Hiki ni Kiboza, hiki ni Kindiki. Haya, Gachagua. Ameno. Iko nje. Okay, Ruto. Yamedanganya. Ladies and gentlemen, our CS is here, our Cabinet Secretary for Health is here. Mpigieni makofi, amefika. Asante sana. Waziri na karibu sana. Now, Madam CS. Nimezoea Bwana CS. Madam CS, karibu sana. And welcome to this wonderful segment. Now, as you've come here, we were just having fun, waiting for you. And in the meantime now, ladies and gentlemen, I'll be introducing, without fear of contradiction, without makasa, without anything, my co-MC, Trevor Ombija. Tumpigie makofi Trevor Ombija. Akona sauti nzito sana. And because we are going to the other section, today is not very official, Madam CS. We are also having fun. These are young people, these are youthful people. And my Gen Z. Gen Z, Gen Z, So ninaomba sisi wote tusimame sasa so that we start this wonderful program with the national anthem. And I would like to invite Kayamba Africa wakuje hapa. And at the same time, I'll be handing over the program to the well-able presenter, Trevor Ombija, to take us further in this. Trevor.
Asante sana. Wapi makofi ya MC Jesse? Thank you very, very much. And now let's all be upstanding for the national anthem, the first stanza and the ESC first stanza as well. Kayamba Africa.
Mungu nguvu yetu, ilete baraka kwetu, haki iwe ngao na mlinzi, na tukae na undugu, amani na uhuru, raha tupate na ustawi. Mungu twaomba uilinde Jumuiya Afrika Mashariki, tuwezeshe kuishi kwa amani, tutimize na malengo yetu.
Jumuiya yetu sote tuilinde, tuwajibike, tuimarike. Umoja wetu ni nguzo yetu, idumu jumuiya yetu.
Asante sana. As we are still upstanding, let me call upon Mulinge Mutuse for a word of prayer, and then we'll start this program officially. We'll only take 1.5 hours for the official commemoration of the World AIDS Day. Amtaki maombi? All right. Mulinge.
Tuamini Mungu na tuombe. Baba, katika jina la Yesu, tunakushukuru kwa wema wako. Asante Mfalme kwa kutupa siku ya leo ambao tumekuwa tukiitazamia. Tunakushukuru siku ya leo kwa kutuneemesha kukusanyika pamoja kama taifa Mfalme na kusherehekea yote ambao tumeona ukitenda katika maisha yetu. Tunakushukuru kwa ajili ya program zote ambao zilianza asubuhi, na hivyo tunapoendelea Mfalme tunakuomba ukoe pamoja nasi. Kila jambo tuongoze hili utukufu ukurudie. Asante kwa kuwa wewe ni mwaminifu, na ni katika jina la Yesu naomba na kushukuru. Amen. Asante.
Na Mutuse walikuwa nafikiria lakini wameconfirm sio wewe. Najua hivyo ndio walikuwa nafikiria. Madam CS, it's good to see you, all our dignitaries. Welcome so much for this function officially. We're only going to take about 1.5 hours. We know that mnataka kwenda kukata rumba na kusakata. Sio? Let me see by the youths wangapi wamefurahi kwa hapa leo. How many of you are happy to be here? Thank you so much. How many of you are in the race? Wangapi walikimbia wakapata medals? A big round of applause to yourselves. Asante sana. Without any further ado, let me call upon now John Kisang, the Deputy County Commissioner, just to give us welcoming remarks, and then to kimbize program Teke Teke, because I know there's still a function you're still waiting for at the end of this.
Waziri wetu, Dr. Dibora, our PSS who are with us here, CEOs of all the institutions that are represented here, ladies and gentlemen, good afternoon, good morning. Welcome to this place. I am John Kisang, the Deputy County Commissioner, Starehe, and I'm representing the County Commissioner who could not make it here because of other equally important engagements. So I welcome you to Langata, one of our 11 sub-counties in Nairobi. And with me, I have come with my ACCs, chiefs, sergeant chiefs who are here. I just want them to stand and wave for us. Just stand and wave, chiefs. So thank you so much. And all the people who have come today, imefaulu. Imefaulu. We thank the organizers for this important day, and that we wish that we will continue like this, Waziri, and we will be happy. So thank you so much. Nimekimbia kilomita 4 na nimeshukuru sana nikamaliza. We used to run when we were young, but now maisha imeenda, miaka imeenda. So nashukuru sana, karibuni, tuendelee, Mungu awabariki. Thank you so much.
Asante sana, makofi kwa John Kisang, is the Deputy County Commissioner. Yes, we are still within time, but I'd asked you earlier on wangapi walikimbia. Now this is the awards ceremony. And I'd like to call upon Dominic Ondieki. Dominic Ondieki from Athletics Kenya. Aje hapa juu tafadhali, Dominic. Dominic Ondieki from Athletics Kenya. He'll be supported by Dr. Patrick Amoth, Director General for Health. They'll start by awarding the 21 kilometers half marathon. 21 km half marathon, and then we'll go to the 10 kilometers road race, and then the 10 kilometers wheelchair race, in that order. Everybody who took part, stand by. This is your award ceremony. Wapi Dominic? Dominic Ondieki. Dominic Ondieki to join me up here, tafadhali, and then take us through how this is going to work for Athletics Kenya. The award ceremony will start with the 21 kilometers half marathon.
Thanks, Trevor. For 21 kilometer men and women, I would kindly request the Honorable Cabinet Secretary to come and present the award to the winners.
The winners are women, number 3, Joyce Chepkemoi. Joyce.
Wapi Joyce Chepkemoi? Ama nichukue hii bronze medal yako haraka haraka. Wapi Joyce Chepkemoi? That is the number 3.
Number 2, Jessica Chelangat. Let's be very fast.
Jessica Chelangat, number 2. Jessica Chelangat.
And the winner, Viola Chemweno.
Viola Chemweno. Ako wapi? Ama tumchukulie check yake mbio mbio. Viola. All right, we'll hand over the checks to them when they come. Let's go to the next category.
The next category is the 10-kilometer men's race. Next category is 21 kilometers men.
21 kilometers men winners. Number 3, Eric Kiprangat.
Wapi makofi ya Eric? Eric Kiplangat.
He goes
ni kama mbio ilikuwa serious. At least bado wamepotea kidogo. Ni kuisha wameisha.
Through the chief guest, the number 3 goes home with 100,000.
100,000 Kenya shillings. Where's the applause for that?
Number 2 goes home with 200,000.
200,000 Kenya shillings.
And the winner takes home 250,000.
250,000 Kenya shillings. That's a total of 550,000 if my math is correct.
Absolutely.
Watu wa magazeti unajua tupendi hesabu sana. So 550,000 in prize money awards to all the winners here. We're calling upon the athletes who are still out there. Come and receive your checks tafadhali. Kabla tuonane nyume attend.
Number 2, Wesley Kipkemoi.
Wesley Kipkemoi. A call for Wesley Kipkemoi.
Wesley Kipkemoi. And the winner, Jonathan Korir.
Jonathan Korir. It is important for us to announce all the winners here because in God we trust. Everybody else must bring evidence. So as long as we've announced you here, consider yourself the winner. Hata cheki yako tukipotea nayo ni sawa. We're buying time for you to show up all the athletes who are in the winning category of the races to come up. This is a 21 kilometers half marathon, men and women. We've just announced. Any of the representatives can also come and pick the checks.
I'll call upon Alfred Tabut, the vice chair, Nairobi. I know these athletes are at the doping control station, most likely. So you'll receive on their behalf. They check. On behalf What channel is this? On behalf of the winners, let's check as Mr. Alfred Aput, Vice Chair Nairobi Athletics, receives on behalf of the 21 kilometers winners. A round of applause. Thank you, Madam Waziri.
Asante sana. I've just been informed now that after the winners are declared, they are through anti-doping control. That's why they are not here, to ensure that they win without any enhancements.
10 kilometers women. Number 3, Winfred Mbite. Number 2, Diana Wanza. And the winner, Gladys Kwamboka.
And I call upon the UN Resident Coordinator, Mr. Stephen Jackson, to be able to present these awards to the winners.
So you know I'm a marathon runner.
Again, this is presented to the Athletics Kenya official on behalf of the athletes, because protocol commands that they have to undergo the anti-doping test before the official awards. A round of applause for him. This category has just been awarded their checks. Total of 550,000 shillings in prize money being awarded to different categories.
Thank you.
Thank you so much. On the men category, number 3, Zakaria Kirika. Let's appreciate him. Number 2, Shadrach Kipyegon. Tumeka wachoyo makofi. And the winner, Shadrach Gumbau. Let's appreciate them. The absentia, the athletes inside here, I believe they are still in the doping control. The absentia allow me to call upon so the representative is going to receive. Hurry up kindly.
Officials from Athletics Kenya to come and receive the checks on behalf of the athletes as we await the process at the Anti-Doping Control Center. All right, let's hasten the process a bit.
Let's appreciate the athletes have just arrived. Let's appreciate them. I can see Gladys Kwamboka. I can see Winfred Mbite.
Kindly just go up the stand so that we take a picture of you. Asante sana. Thank you very, very much.
Let's appreciate them once again. Number 3, Winfred Mbite. Number 2, the other side. Number 2, Diana Wanza. Let's appreciate them. And the winner, Gladys Kwamboka from National Police Service.
And I call upon Mr. Bright Redman to come and present this award to these winners. Bright Redman is the PEPFAR coordinator for the country.
10 kilometers men, are they around? 10 kilometers men, last call. 21 kilometers. As we are consulting on the 10 kilometers, wheelchair, let's get ready.
Asante sana. Big round of applause for the athletes as they go down. Thank you very, very much. Getting ready for the 10 kilometers wheelchair race as well.
10 kilometers wheelchair race, women category. Number 3, Christine Mudeu. Christine.
Where is Christine?
Let's appreciate her. Once again as she comes. Number 2, Lecho Akot. Let's appreciate her. And the winner. Can you guess the winner? Caroline Wanchira.
And I call upon the Principal Secretary, State Department of Medical Services, Mr. Harry Kumtai, to make the presentation to the winners.
Wheelchair men, get ready. Riche. Wheelchair men category. Number 3, Milton Ilahuya. Let's appreciate him. Number 2, John Wambua. And the winner.
Applause. And as a quick announcement, thank you so much. I believe that's the end of it. Asante sana Dominic, asante sana Dr. Patrick Amot, Director General, Ministry of Health. There's also a quick announcement to all the athletes from number 4 to number 10. You're meant to get some awards as well. Amujasahaulika. Tafadhali look for Alfred Tabut. He's raised his hand over here. Athletics Kenya. We wouldn't manage to line up all of you here in the interest of time, but we are aware from number 4 up to number 10, you will still get your awards. Kindly see Athletics Kenya official Alfred Tabut. All right. Thank you very much. A big round of applause for all the winners. Tafadhali DJ, asante sana. Asanteni sana. Without any further ado, it's time for cake cutting. Hapo sasa ndio nakuanga expert mahali pa kukula. But I'd like to call Jane Mokami. Jane Mukami to come up. A big round of applause for Jane Mukami. You better clap for her because she's the cake matron. Akiona kama hujapiga makofi keki unaweza kosa keki hapa. Jane Mukami will take us through this next session very briefly.
Thank you so much. All protocols observed. I would like to invite our dignitaries for this cake cutting session. Our chief guest, Cabinet Secretary, Dr. Deborah Baraza, PSMOH, PS Harry Kimtai, PS Mary Modoni, Director General for Health, Dr. Patrick Amoth, the Chair Nsdcc, Mr. Jeffrey Gitu, CEO Nsdcc, Dr. Ruth Masha, Country Coordinator PEPFAR, Brian Redman, Country Director UNAIDS, Mr. Victor Bompai, CEO AHF, Dr. Samuel Kinyanjui, the NEFAC CEO, Mr. Nelson Otoma, and the community representatives already identified, as I request the cake to be brought here in front. Please join us.
I believe it's only easier if they all move here, so where the cake can be cut from this point. All right, and face the cameras on that side as well. Then we'll take the pictures up here. Okay, once the cake is done, and then there's a photo session right up here. All right, Kayamba Africa, sasa ni wakati ni wenu sasa. I'm a DJ Wiwa. Remember, like I mentioned, in God we trust. Everybody else must bring evidence, so kindly make sure you face the cameras. And we broadcast that on the screen as well, so that those who cannot see from the back can see that indeed it's a cake we are cutting. All right, hold on 1 second. DJ Shkilia kidogo, DJ Shkilia, Jane.
Sorry, before we cut the cake, we would like to remember the ones we have lost to AIDS-related deaths. And we have a few candles. We would like to light the candles and have a moment of silence, kindly.
After we light the candles, we'll observe a moment of silence. So we beg your indulgence on that. Once we light the candles, kindly let's all observe a moment of silence. I will let you know when that moment is here.
Kindly, community representatives, join us too. Thank you. Let's all stand and have a moment of silence to remember all those who have lost to AIDS-related illnesses. To read the message on the cake, and it says, together we remember, together we heal through love and solidarity. Together we remember all those who have lost their lives to AIDS-related death. We heal, and then we need to come together through love and solidarity, all the stakeholders, to meet the target by 2030 to end AIDS as a public health threat. I would now like to invite our chief guest and 2 community representatives to cut the cake, and then we'll have a photo. Thank you.
All right, as that is happening, King Kaka, over to you sasa. Wakati keki inakatwa sasa. King Kaka.
Hey.
Twende DJ Wiwa.
Tuamke tu tuimbe. Help me.
Let's all be upstanding, tafadhali.
Let's get up, please.
There's a cake cutting in commemoration. Dignitaries to come and line up here while they voted for photo session. I know I mentioned earlier on that in God we trust. Everybody else must bring pictures, videos, and time codes. All right? Na M-Pesa messages. Kindly line up over here, tafadhali, for pictures. All our dignitaries in the cake cutting session, tafadhali. Just line up here for a quick photo session, and then Kayamba Africa will hand over to you. Only 3 minutes. Then we get into some remarks from our leaders here. All right? Tafadhali, let's just line up over here. All the dignitaries who are here in the cake cutting process, Madam PS, Madam CS, all the PSs, Dr. Patrick Amot, tafadhali, just a quick photo session right next to the cake so that we have evidence that ndio tulikuwa na keki. All right? Do not worry, keki itakufikia pale nyuma. I can see some worried faces back there. Don't worry. We'll make sure you get some pieces of cake as well. For my colleagues in the media industry, tafadhali, wanaomba muangalie mbele. All right? They're saying that you come up here, tafadhali. all the dignitaries come up here for the session of our media guys. They want to take a picture. Tafadhali, let me just have them up here. Kayamba Africa watasonga nyuma kidogo tu. Let all the dignitaries come up here, all the way to where I'm standing. Hapa hivi mwisho. Omanyala. Vipi? Good to see you. All right. Now, line up, face forward. All smiles. Tafadhali, in just less than 2 minutes. Let's finish the photo session. Face forward, tafadhali. All smiles in 1, 2, 3. First picture. Second picture. Third picture. All smiles. Line up. Line up. All right. In 1, 2, 3. Photo session, and it's done. Kayamba Africa, over to you. Just one song. One song.
All the dignitaries kindly remain there standing. Simameni tu hapo because we're celebrating Kenyans, ndio? Wale walitutangulia na wale ambao bado tunaendelea, tafadhali. If you're a proud Kenyan, wherever you are, simama juu. If you're a proud Kenyan, simama juu popote ulipo. DJ wekelea hiyo. Let's celebrate together. Aya, DJ tupe tu hewa tafadhali. Tupe hewa. Tushangilie Kenya, taifa letu tukufu, Kenya tunayoipenda daima. Tushangilie Kenya, taifa letu tukufu, Kenya tunayoipenda daima. Kenya yetu tunayoipenda daima. Twajivunia sana tukijiita wa Kenya, nchi yenye baraka. Twajivunia sana tukijiita wa Kenya, nchi yenye baraka. Kenya nchi yenye baraka. Wapi kelele wa Kenya? Nchi ya usalama, kamwe hatutaiacha. Kenya makao yetu ni nchi ya usalama, kamwe hatutaiacha. Hatutaiacha. Anayependa Kenya ni yule mwenye kupenda haki kwa watu wote. Kenya ni yule mwenye kupenda haki kwa watu wote. Haki kwa watu wote. Ukipenda Kenya ujitenge na mambo yenye kuvunja amani. Ukipenda Kenya ujitenge na mambo yenye kuvunja amani. Hatutaki matata Kenya. Wapi kelele wa Kenya? Matata Kenya. Haya, tuko tayari. Haya, cheers. Ongoza, twende right. Very simple, eh? Very bad, from that side. Haya, tuanza left, twende. Kenya kipenzi chetu, hatutaiacha milele na milele. Kenya kipenzi chetu, hatutaiacha milele na milele. Kipenzi chetu, nchi yenye upendo, hatutaiacha daima na milele. Kenya kipenzi chetu, hatutaiacha milele na milele. Kenya kipenzi chetu, hatutaiacha milele na milele. Mama yangu tena ni baba yangu, hatutaiacha milele na milele. Kenya kipenzi chetu, hatutaiacha milele na milele. Kenya kipenzi chetu, asante sana DJ. Hatutaiacha milele na milele. Asante sana makofi, asante sana Kayamba Africa, thank you so much. Mimi ni ule prefect mtiaji mwenye nasimamisha ngoma katikati. I know. Asanteni sana. As our dignitaries settle, thank you so much. I'd like to call upon John Kisang, to then guide us through the next session of A Decade in Progress, and to call the Nsdcc CEO to make her remarks. John Kisang. A round of applause for John Kisang as he comes up. Wapi makofi kama ile yenye mlikuwa mna dance nayo?
Yes. Again, I want to greet you. Habari zetu wote. Now, I don't have much to say, but I want to invite Dr. Ruth Laibon to make a remarks on the decade of success in the fight against AIDS. Dr. Ruth, karibu sana.
A round of applause for Dr. Ruth Leboni Masha. She's the Nsdcc CEO. She's done an amazing work. And in the next 10 years, she wants to tell you what we've achieved so far. Asante sana.
Thank you, our Cabinet Secretary, our Principal Secretaries, Chair, DG. Allow me to observe protocol. Before I start, I'd like to invite Dr. Rose Wafula, our Head of NASCOP, to just make a few remarks, and then we will share with you a few pointers on where we are today, World AIDS Day, the first World AIDS Day marathon. Nani hajakimbia? Nani hajakimbia? Nani amekimbia? Good. We ran, and we've been running since 1984. Daktari?
Good afternoon, our Cabinet Secretary, Dr. Deborah, Principal Secretaries, all dignitaries, ladies and gentlemen, good afternoon. Once again, my name is Dr. Rose Wafula, the head of NASCOP, the National AIDS and STI Control Program, which is the health sector arm that is responsible for the HIV response. It's a great honor, Dr. Masha, for us to be here today. And I think for those who are not there in the 1980s when we were young, they may not understand. But for those of us who are above 50 and so, it's a really rare experience if you think about where we've come from. More so for those who are in the health sector, it was very disturbing. And I'm hoping in today's celebration, we will take time to reflect and be glad that through collaboration, we've come this far. It is an honor to be the head of NASCOP at such a season where we have hope and we can sit calmly and have conversations about the future. This was not possible years ago. And therefore, I want to thank all of you for the work you have done to bring us this far. And I look forward to continued collaboration together with our colleagues in National Syndemic Control Council. Asanteni.
Thank you very much. That's Dr. Wafula. Sometimes back in 2013, Dr. Wafula and I used to just dream of how we can end AIDS in children. And we used to sit somewhere just thinking about what can we do different. And today we celebrate those milestones. Before I just give you the statistics, allow me to just remind us the history. I know for Gen Zs wale muko hapa, history yetu labda mjui sana. 1984, patient 0. First case of HIV was reported. And we had a study in Majengo. It was an observation cohort that you were observing. And the study was just supposed to check for us sexually transmitted infections. And they discovered that there were a group of members within those cohort whom they thought would have HIV or whom they thought were HIV carrier because nothing was happening to them. And of course, science later disputed that. 1985, we had about 26 cases reported in Kenya, and all were among sex workers because they're the ones who are willing to go for diagnosis. And of course, in the newspapers, we had the first headline saying, killer sex disease in Kenya. So we come from far. 1987, 1989, we had about 3,000 cases. And today we pay tribute to Joe Muriuki, the first man to walk into a media house and say, look, this virus is not in animals, it is in people. And Joe Muriuki, Wangeshi started talking to us. For those of us who were in school that time, they came around every high school and they told us that there was a virus. Wangeshi, God rest her soul in peace, allowed us to document her story until she died. And we did that. And Raphael Tuju, in the famous film, The Silent Epidemic, documented the life of Wangeshi even after her death. And this era marked mass denial, stigma, fear, mystery, and of course, accusations and people dying. 1999, President Moi declares HIV as an emergency and a national disaster, and he establishes a National AIDS Control Council and requests that we all come together to coordinate. During that period, we get Cameron drug, which of course was not really the hope we were relying on, and most of the people we lost that time because they were relying on that drug. It was infamous. 2000, we had our first vaccine candidate at Kavi. 2001, we participated in the trials for drugs for preventing mother-to-child transmission. We had Global Fund come here, and President Kibaki in 2002 again took up the war from President Moi, the late President Moi, and most importantly, 2003, PEPFAR. Thank you, Brian. On behalf of Kenyans, we want to say thank you to the people of America, because at this time, Waziri is our first discussion about how we can get everyone on antiretroviral medicine. I want to say that today we are celebrating from Assunta baby. For those who are old, remember how we waited for Assunta's baby. Assunta, a woman living with HIV, decided to get pregnant, and we documented our journey because we were waiting to see what will happen to the baby. And then baby Assunta declared the baby is HIV negative, and she gave hope to many, many Kenyans. So today, we've walked a journey, and in this journey, we can see how far we have come. We have had prevalence rates reducing from as high as 14 to today when you're saying we have 3.3%. And new infections have reduced from about 100,001, 448 in 2013 to 16,752. Most importantly, today we are here to celebrate life. Life of people living with HIV. Life of people of courage. Life of people who have fought stigma. Life of people who are courageous enough to say, I am not going to die. I am going to hang on until treatment comes. Today, while we were running a race. I know most of us almost gave up. I personally almost gave up twice, and I wanted to stop. And every time I stopped, I said, actually, if I stopped here, I will not finish the race. Sometimes, even at the individual level, that is what they feel. So today, we have about 20,480 AIDS-related deaths, and that is why we have come here to spotlight, because we have a challenge that we have done well. We have reduced new infections, prevalence is going down, but as a country, we have the 7th highest burden of deaths in the world. This is not supposed to happen. It is something we can come together if we supported every brother and sister to go and seek medication. And finally, I think one of the most important things that we need to look at is the children. I don't know who is controlling the slides. You can look at, we are failing our children. And we are failing them because 3,743 children were infected with HIV last year. And we lost 2,607 children to AIDS-related illnesses. Again, we see that new infections continue to occur among children, even when we can prevent mother-to-child transmission. Next slide. Men and boys, vijana mko, are the men here? Today, the men are absent. We are very disappointed, but I can see all of them here. Wanaume, muko, I can see you here. We are here to spotlight on the men, because the uptake of services, especially HIV and TB services for men and boys, is poorer than for women and girls. And what you're seeing is that whereas there are more women infected or living with HIV, we get more men dying proportionately to the number living with HIV. 485,000 men living with HIV, and they contribute to about 48% of all the deaths that occurred. So we are calling that we support a brother. The song we have just sung says that, light your candle. When you see a brother who is broken, you light the candle for them so that they see the light. So we hope we'll be able to do that. Again, we have a challenge of adolescents, girls, and young women especially, and this is a challenge of teen pregnancies. Last year, 241,281 children, because you have to say them, children and adolescent girls came to our facilities to deliver a baby. We cannot accept child mothers because a child should be in school, should be running, a girl should be playing catty, not doing motherhood. We want to say no to child motherhood until when the child is ready to become a mother. We had about 2,000 new infections among adolescents, and again, also sexual and gender-based cases, violence were domiciled around that age group. We do need to go from here to somewhere. Waziri, today we celebrate SHA and Afya Care because we have been worried for so long. I have brought up a child living with HIV, and one time she read a story, donors are exiting, and she came to me and said, who will buy the medicines? And I said, we shall reform health and then medicine shall come. So Waziri, in your leadership, we want to encourage Kenyans to uptake the health sector reforms, the SHA, the Afya Care, because this is the first time we are coming closer, anywhere closer towards self-reliance. Because if everybody will be insured, then even people living with HIV will be insured and they can access commodities. So that child that is now a lawyer and she's doing so well, I keep telling her that, you see, I asked you to continue living because the medicines will soon be here. And that happened. PEFA came in. She was actually patient 00 number 1 in the hospital she went to. And today she's a lawyer working in one of our banks. And I celebrate her as I stand here and also celebrate that the milestones we have done is because of those children. We are also anticipating that as we move forward, we shall do the 10% remaining, and we are calling upon everyone to celebrate the 10 years of success, but to refocus and purpose that we shall stop being silent about HIV. We shall talk to our children, fathers who are here. Is there a father here? Yes, Nyaga is here. Nyaga told us about men who take condoms and place them in the house, hoping that their sons will see them. We want to speak about sex and sexuality to our children with the appropriate age from when they start growing until they become adolescents and adults. We are calling that we stop shying away because our children sometimes perish because of lack of knowledge. I want to stop there and say we do appreciate all of us for coming, and those who have ran the race, please join us again to complete this finish race. And 2030, we hope we shall come back to this very venue to celebrate success. Asanteni sana.
Thank you very much. A big round of applause for Dr. Masha. Asante sana. Nsdcc has been instrumental in the war against HIV and AIDS. Now I only have 10 minutes to slot in 5 people. So it means you all have just 2 minutes maximum. You're just telling us what way forward. What do we do forward to achieve the Vision 2030 that we have of eradicating HIV and AIDS? That's all you say. 2 minutes only. Starting with Nelson Otuoma, Executive Director, NEFAC. Nelson Otuoma, big round of applause for him as he comes up. Only 2 minutes. If you see me pacing here, it means your time is up. Ukiona nimeanza kukimbia, you know your time is really, really up. All right? Dr. Samuel Kinyanjui, stand by. You're the next online. 2 minutes only, sir.
Thank you. Madam CS, allow me to say all protocol observed so that I go straight into my point, because I was part of the team that hurried him that we get 2 minutes, although I'll get 3 minutes. Now, we civil society communities, including people in the HIV/AIDS, we are happy to join your team in the Ministry of Health and renew our commitment towards ending AIDS as a public health challenge. Allow me to say that I come from NEFAC, which is a group that has been celebrated and mentioned by Ruth here. So we celebrate those who have left, like Joe Murioki, but we also celebrate those who are still living, including Asunta Wagora and Dorothy Onyango, the teams that founded NEFAC before some of us joined. But the core business of that team was to remind the world that HIV, the H in HIV means human. So it is in the human being. I know progress has been made, and thanks to the Ministry of Health and their partners, including Global Fund and PEPFAR, but there are gaps. We have been alerted to the gap among children, which according to us is quite unacceptable in this day and era and the technology that we have, that we still have children presenting with HIV during birth or breastfeeding. But we welcome the commitment from the Ministry of Health to end AIDS among children by 2030. Of course, somebody said 2027, but if they bring resources, we'll follow them suit and then end it in 2027. But allow me also to say that Kenya, because this program has been working so well, ARVs have turned HIV into a lifelong chronic medical condition. And where there are ARVs, people are not dying. And you now have in Kenya a large cohort of people who are aging with HIV who are presenting with non-communicable diseases. So when we talk about hypertension, diabetes, kidney problems, it is also affecting persons living with HIV. The other point really is that, and we are happy that the PS Public Health is here, if you get a person living with HIV in Kenya who is sick, they are sick from TB. If you get a person living with HIV who have advanced HIV disease or who is dead, it is because of TB. I think something can be done so that we end TB among persons living with HIV and the general public. And therefore, I'm talking to the issue of dockets, because sometimes we follow the HIV path. And I want to stand here and congratulate the Ministry of Health and express our commitment that we support your integration agenda, because HIV will not kill people, but non-communicable diseases or infections like TB will kill people. Going forward, so that I end first, we do not believe that in this country you have 1.4 million people who have HIV and you come with social health insurance fund or social health authority and exclude that team. So my strong call today is that we have, as part of integration and a part of going forward to sustain the work Ruth was talking about, get HIV deep inside social health authority. And along that line, we heard of chronic illnesses fund. We also heard of critical illnesses fund. And we think that for children who have HIV, automatically that is emergency and critical, and it should not be ignored by the SAR.
All right.
For people living with HIV who have NCDs, to manage those NCDs, you cannot leave them behind and say that we are taking them to PEPFAR and Global Fund. We must get a way in which we are going to work together to make sure that they are part of Social Health Authority. And our duty is to mobilize all persons living with HIV to register with SAR, so that they also get the benefits that this country is enjoying. Thank you very much.
Thank you very much, Nelson. A big round of applause for Nelson. Just put the microphone down there. It's all right. Dr. Samuel Kinyanjui, Country Program Director, AHF Kenya. Round of applause for him. 2 minutes on the dot, sir. Now you have 1 minute, 59 seconds.
Thank you very much, Honorable Waziri, PSS, all protocols observed. Thank you very much for this opportunity. As part of the civil societies working in this country, AIDS Healthcare Foundation, working with other partners, I think Nelson has already mentioned some of the key points I wanted to mention, but I'd like to say this. First is to acknowledge the great progress this country has made. Thanks to the leadership of the government and to the strong partnership with the particularly PEPFAR and Global Fund. We need to applaud them and remember them many times. They've saved millions of lives, many jobs, transformed our community. Number two, if we do not defend what we already have, then we risk losing everything that we have invested in. So we have concerns. And one of the concerns is about reducing funding. But we are grateful that they're reducing funding. Number two of our concern is the continued stigma in the community and the continued discrimination of people living with HIV in our facilities. Why am I saying they are discriminated? Most of our CCCs are in the broken buildings. Most of the healthcare workers working in CCCs, most of them are the ones with chronic illness or indiscipline. And we depend a lot of the time on the partners. So we need to do something about that. What can be done about that? Nelson has already talked. One of the requests we'd like to make as a non-state actors is continued procurement of medicine at a central level. This will ensure quality, efficiency, and so that the quality of medication being given is not of no doubt. The efficiency, because we are buying in bulk. Number two, include people living with HIV under the chronic illness program under SHA. I'm asking specifically, Waziri, for 4,500. We've done the math per year, only 4,500 per year. You know what that will do? The counties, the hospital will treat people with living with HIV as a customers now. Right now, we are treated as a burden. And that's why no one cares about our clinics. But we only give us 4,500. We'll become a customer, and the counties will be able to meet the needs of these people progressively. Sustainability, there it is. The other thing that we also note is to include, when we talk of integration, let us be careful about the integration, not go the integration. Some countries have gone through integration and lost everything. What is so strong about healthcare, HIV and TB programs is accountability, documentation, and measuring outcomes. The other MOPCs, they don't measure outcome. That's the issue. So if we can take over what is in HIV and bring in the MOPC into it, we are great. And integration will be great for us. Asante sana.
Thank
Mungu
you
awabariki.
very, very much. Where's Brian Redman, the country coordinator, President's Emergency Plan for
Asante.
AIDS Relief? That's PEPFAR. Also 2 minutes. We appreciate your support.
Asante.
2 minutes.
Waziri, please let me say all protocols observed. And let me also really thank all of the runners that came out. Runners, walkers, and rollers. Really, congratulations to everyone on the races that you participated in. Today, we really pause to reflect on how far Kenya has come in its journey to end HIV. It's also an opportunity to celebrate the wins and remind us of work that lies ahead. As Ruth mentioned a generation ago, conversations about HIV were shrouded with fear and stigma. Hushed tones were used to speak about the disease that had wreaked havoc on so many families. Today, we speak openly and fight fiercely and continue to stand together as we push for a world that has ended HIV as a public health threat. I'm therefore proud of the incredible steps that Kenya has taken, that has made, and I look forward to the future where HIV is no longer that threat. While the country has climbed some steep hills, it's not yet at the summit. It can only get to that point by sustaining and accelerating the progress made so far. This calls for collective action from all of us and demands that Kenya increases its domestic investment in health. Indeed, the year's theme, collective action, sustain and accelerate HIV progress, that's GHSD's or PEPFAR's theme, is a powerful reminder that the journey to an HIV-free Kenya is not one that can be walked alone. It requires all of us working together with a sense of urgency and shared purpose. We have to continue to innovate and really work towards new progress, such as CABLA, and I'm happy to say that CABLA is coming in the next year. We also need to continue to address GBV and try to get more men into those services and address those populations that still have not yet come in. So as I look across the audience, I see change makers, health workers, advocates, policymakers, and community leaders that really have a power to address GBV and HIV. Let's take a collective action and really work towards ending HIV as a public health threat. Finally, let me allow me to point out that the world is watching Kenya, and that the country is an opportunity to show what we mean by leaving no one behind. And I'd really like to applaud the Ministry of Health for putting together the Sustainability Operational Plan. And it really is the pathway for us to understand how we're going to do that integration that's already been discussed. And I look forward to working with you on making that integration happen and really making it work with UHC to address all those concerns. So I urge you to be bold in your vision as a country, innovate, and remain steadfast in your commitment. Asante sana.
Thank you very much. A big round of applause for Brian Redman. Let me have Dr. Stephen Jackson, the resident coordinator, United Nations, as well. Just 5 minutes. Also went to recognize, actually 2 minutes, went to recognize the presence of CEOs of BioVax, National Cancer Institute, KEMSA, NACADA, Kenya Pipeline Corporation, and the Director, Ministry of Foreign and Diaspora Affairs. Welcome and thank you for joining. 2 minutes, sir.
Thank you, MC. Waziri, waheshimiwa, marafiki, vijana, hamjambo. You know, it's been a long race against HIV/AIDS since 1984. We heard that from Dr. Ruth. We're starting to win the race, but we learned, any of us that ran or rolled or walked this morning learned an important lesson. The last bit of the race is the hardest bit of the race. What we're finding, it's terrific. We have 4 times fewer cases in Kenya of new infections than we had 13 years ago. And you heard the numbers that demonstrate how we're really close to winning this race. But the last bit's the hardest. Why? Because the new infections are in the hardest to reach populations. Whether we're talking about sex workers, people who use drugs, sexual minorities, whether we're talking about kids, whether we're talking about this triple threat that brings together teenage pregnancy, gender-based violence, and HIV infection. So what do we need to do? 4 things, and we need your help. First, we need to come together like we never have before. We need to work together, Kenya government, national level, county level, civil society, you the people in your communities, you the leaders in your communities, with the international partners, and the United Nations is here to help. The second thing that we need to do is to work harder than we ever have before. The third is that we have to work without fear, and we have to destroy stigma wherever it is. The young people of Kenya this summer showed themselves to be fearless. We need that fearlessness in the fight against HIV/AIDS. Fight stigma, stand up against it wherever you are. And finally, we need rights. The global theme for World AIDS Day this year is about choosing the rights path, because this is a human rights issue. And nobody should be exposed to the risk of HIV. And anybody that has HIV has a right to the treatment and the support and the love that they deserve. And so let's all stand together to protect all those things, and let's make sure that, as Dr. Ruth said, we can come here in 2030, run a race, and celebrate that we made it to the finish line. Asanteni sana.
All right, thank you very much. A big round of applause for Dr. Stephen Jackson. Let me have, on behalf of Suzanne Silantoi, Tom Nyakaba. Tom Nyakaba, the Chief Officer Public Health. If you're here, going once, going twice. If you're not here, we are moving on. Tom Nyakaba, on behalf of Suzanne Silantoi. He's not around. Thank you very much. Let me have Geoffrey Gitu, the Board Chairperson, National Endemic Disease Control Council, to make remarks. Geoffrey Gitu, Board Chairperson, National Endemic Disease Control Council, to make his remarks. A big round of applause for him as he comes up. And right after that, sir, in your indulgence, kindly just invite the PS for State Department for Public Health and Professional Standards. 2 minutes, sir.
Cabinet Secretary, all protocols observed. I want to start by introducing my board. Just stand up. Salimieni watu.
Big round of applause for the board. Asanteni sana.
Do we have any officials from Nsdcc?
Officials from Nsdcc?
Okay, thank you very much. It's an honor to stand with you here today, running for such an important cause, promoting the health of well-being of our men and boys. Whether you ran 2 kilometers or the full 21, this event has been more than just a race. It's powerful. It's a powerful statement of unity and determination to achieve an AIDS-free Kenya by 2030. I hope today's efforts have amplified this vital message. In engaging men and boys is crucial in this fight, not only against AIDS, but also in addressing issues like unintended pregnancies and gender-based violence amongst adolescents. By focusing on their health and well-being, we can create a more inclusive environment that benefits everyone. This commitment also extends to tackling other health challenges such as tuberculosis, substance abuse, and sexually transmitted diseases. This journey to end this pandemic is not easy. It's worth every effort. So let us move forward together, strengthening health systems, scaling up community initiatives, and protecting vulnerable groups. Together, we can build a healthier Kenya. Today, I want to state that stigma is real. Madam Waziri, hata mimi wananiita chair wa condom, which I'm proud if I can make a difference. Asanteni sana na Mungu awabariki. Thank you.
Thank you very much. A big round of applause for Geoffrey Gitu, the board chairperson, National Endemic Disease Control Council. Allow me to break protocol here in the interest of time, and let me just invite the PS Mary Mudhoni, Principal Secretary, State Department for Public Health and Professional Standards, to come up to the podium. A big round of applause for her. I'm sure you've seen her online doing the Lord's work. Thank you very much.
Thank you very much, Waziri, my colleague PS, ladies and gentlemen. It's a good afternoon. Now, you know, my boss is around, so I don't want to talk much. But looking at the figures that Masha really gave today, that our country has recorded in 2023 approximately 16,752 new infections. Waziri, when I was growing up, for those who are close to my age, you remember very well, you would open your TV screen and the first thing you would see is AIDS kills. You go to a hospital, AIDS kills. You walk anywhere, like we would be having posters all over the city on AIDS kills. My emphasis is one, creation of awareness. These our children, these our Gen Zs, they have not been born when AIDS was real AIDS. And they don't seem to know. That is why the infections are high among the young people. Awareness is going to be key if we really want to eradicate AIDS by the year 2030. Funding. And this, I want to applaud our development partners and other agencies that we've walked the journey together. Don't get tired, because funding sometimes can never be enough. Yes, we will budget for the same, but this is a collective responsibility for all of us so that we ensure that issues, we clear AIDS by the year 2030. And finally, our foot soldiers in health, the community health promoter. Masha, I want to challenge you that you work very closely with the Division of Community Health so that we inject this into the curriculum. And while they move from household to household, they will be able to speak to the many, many Kenyans, the 12.5 million households that we have in this country. And I am sure we are going to achieve that which we want. Waziri, I thank you, and back to you.
Thank you very much. A big round of applause for Mary Mudhoni, the Principal Secretary, State Department for Public Health and Professional Standards. Let me call now upon the PS Hari Kimutai, the Principal Secretary, State Department for Medical Services. A big round of applause for him as he comes up. He's the man behind SHA. He's been talking about it every day. I'm sure he'll mention something about it as well today.
You have also been one of them. Thank you. Our Cabinet Secretary, Dr. Deborah Barasa, my colleague PS, Mary Mudhoni, our Director General, the Board of Management of Nsdcc, our development partners represented here today by Brian, and I've seen Jackson has left, and all of us. Can I say also good afternoon? When Trevor said that we have 2 minutes to speak, indeed, from what I wanted to talk about, I've chosen two issues. Issue number one, I look at the figures that Nsdcc CEO has presented. Very encouraging because the declining. Very encouraging. And therefore it tells us one thing. We stand at a very crucial moment. And today, as we celebrate the World AIDS Day, we chose to have a marathon, a race, to end AIDS. And we targeted men. We always believe men lead in our society. It is our time that we men must stand up to lead so that we are able to end AIDS by 2030. We all know that many of us, and we come from diverse backgrounds. There are those who are marginalized. We also need to bring them on board because you cannot leave any community out. Because the moment you leave them outside, then that's where our chain will be broken. And that's where we will not achieve our target. But I believe with the efforts the ministry and the government, together with the relevant partners, are putting in place, we will be able to achieve our target of ending AIDS by 2030. Two, we've all had, and we've talked about it, and thanks to my colleagues has also mentioned about it. One of the key issues is declining global donor funding, which poses additional challenges to what we want to achieve in our country. And I'm seeing this as one case that is going to derail our process if we are not careful. However, there is hope, ladies and gentlemen, that we have put in a response mechanism that is bold enough. Within the health sector, the reforms that we are bringing, I can bold steps in different forums, international, when we talk about reforms that we are undertaking within our country and health sector. Sometimes we are challenged that is too ambitious. But Kenyans, I want to urge you to be ambitious. We have to be ambitious to end AIDS by 2030. If we are not, we will not end AIDS by 2030. What are these ambitions that we have put in, the reforms that we have put in place? We have brought in the universal healthcare coverage. Mbija was calling me Mr. Shah. We have walked this journey together with Trevor. And in we are achieving. I want to tell you this, that so far, more than 15 million Kenyans have now registered under SHA. Let's clap for the Kenyans because they are all ambitious. They are racing against time as they continue registering. And I want to urge you all to register because we are all racing against time to end AIDS by 2030. My colleague has talked about community health promoters. We indeed, in SHA and the State Department, have worked very closely with community health promoters, together with our Ngao administration. We've come up with a strategy to make sure that we visit each and every household. Every Kenyan is registered. No one should be left behind. As donors are parting ways with us and saying bye-bye, and I know one of it is 2030. One of the questions that was posed to our cabinet secretary by one of the news reporters is, what do you take of the coming in of Donald Trump power? Do you think the donor partners now will be withdrawn in terms of support, and especially PEPFAR, because that is where we are relying so much? I want to tell you this, that we still have hope. We know that they have helped us, they have laid the foundation for us, but it's time to build on strong foundation. From there, we need to end AIDS. And what are we doing? We are encouraging domestic resource mobilization, and this is where we talk about social health authority. Because all of us here are registered. We've got to strengthen this. We've got to strengthen this. But one of the key issues that I've heard Nelson talk about, we have not left anyone behind. We want members, your members, the 1.4 million Kenyans, to register and they will benefit from social health authority. I want to tell you this, that our technical teams are still working. We take note of your concerns. We thought that you have the program that is going to take care of you. We also need to bring everybody on board. I remember one time when you were discussing with Brian, and I said universal healthcare means everyone is in because it's universal. Otherwise, it will never be universal. So, ladies and gentlemen, our target is to end AIDS by 2030. What have we done as the ministry at the moment in terms of policy? We've developed a roadmap. We've developed a strategy together with our development partners, and we have it. It is ready. What remains now is to roll out that strategy and to bring everyone on board so that we're able to achieve end of AIDS by 2030. So I've spoken within 2 minutes and I've spoken 2 points. It is therefore my singular honor to request that we all be upstanding as we welcome our chief guest, the Cabinet Secretary, Ministry of Health, Dr. Deborah Barasa Mlongo. Tumpigie makofi mpaka afike kwa stage. Asante sana. She's our captain, she's our champion, the one leading us to end AIDS by 2030. Asante sana, Waziri.
Asante, thank you. Please do have your seats. Principal secretaries, chairpersons of boards, CEOs of state corporations, UN resident coordinator, Mr. Steven Jackson, PEPFAR coordinator, Mr. Brian Retman. We have UNAIDS country director, also Victor, community representatives, our partners, distinguished guests, ladies and gentlemen. Good afternoon. It gives me immense pleasure to join you this morning to commemorate 40 years since the first case of HIV being detected in Kenya in 1984. This World AIDS Day is special to me as the celebration is critical to shape our discourse for the now and future generation who may have not had the chance to see and experience the epidemic in its worst case. We all recall the experience on our continent, the early 2000s, a negligible number of HIV-positive clients had access to diagnosis and life-saving treatment. On the health facilities, they were swamped with dying patients as doctors struggled to give their best to manage the onslaught of devastating opportunistic infections. Homes were filled with graves, orphans who were helpless filled our communities and our country, and all sectors lost a significant workforce, and the stigma in the communities was at its highest. It was devastating at that time, even as was said by Dr. Rose. HIV and AIDS crisis that threatened the social, economic, and development fabric of the country, and the emergency situation called for out of the norm action. The ravaging epidemic at that time threatened to wipe out communities if nothing was done, and done very fast. The Kenya government declared HIV/AIDS a national disaster in 1999, resulting in a national move towards creating awareness and advocacy for prevention of new infections. And globally multilateral investments through PEPFAR. Thank you so much, Brian and your team, and really we appreciate the great work and for standing with us throughout this. I have seen practically, even working in the HIV programs, what you have done, and we really appreciate your support, and equally for the Global Fund, who are really instrumental in terms of supporting us to reduce the HIV infections in our setting. Since 2003, the government and its partners have built the mechanisms for HIV/AIDS management and strengthened public health systems, which we even leveraged on during the COVID-19 pandemic. And I want to assure Kenyans and partners that we treasure and we will guard the gains made over the years. Today, Kenya has an estimated 1.4 million people living with HIV, with an overall UNAIDS target of 98, 97, 94. As of the end of September, 1.36 million people living with HIV were receiving HIV treatment in Kenya, and there are 3,752 HIV treatment sites, over 2,000 that have been digitized, and over 8,851 HIV testing sites encompassing public, private, and faith-based organization-supported facilities in the country. 90% of people living with HIV on treatment are on the digital platform. And a majority of people living with HIV, that is over 90%, receive care at level 2, 3, and 4. And specifically, 21% of people living with HIV are cared for at level 2 facilities, with 27% at level 3 and 45% at level 4. We are also on course with decentralizing high technology lab services for DNA PCR, with 2 counties, Kisumu and Migori, already onboarded. Within the last 10 years, there has been a remarkable decline in new HIV infections, HIV-related mortality, and mother-to-child transmission by 83%, 64%, and 65% respectively. As a result, people living with HIV today engage in social and economic activities and are core partners in the response. It is the strong partnership and collaboration with every stakeholder here that has transformed the response and made these remarkable achievements. Exciting innovations such as long-acting injectable ARVs for HIV prevention, self-testing, and integral role of affected communities in the response are transforming our approach. Coupled with education and primary prevention efforts, these breakthroughs give us a glimpse of a future free of new infections. So, ladies and gentlemen, while we celebrate, we note that there is need to address a few gaps. One of them being new HIV infections among children and outcomes of children living with HIV and in care, which is still below the UNAIDS target, as has been clearly reflected by Dr. Marsha. The men and young people living with HIV have not met the UNAIDS targets. There is an urgent need to address the gaps for their own health, but also as key pillars in addressing the work of ending AIDS. We are happy with the DREAM initiative, 000, but then we need to have something that has been customized for the men and the young population. And so we hope that the team will take it up and address it. Again, geographical disparities. We've seen the 10 counties, but we see that there's disparity in progress, which requires our thinking and response in the undeserved counties or underserved counties within our country. Among those already in care, as has clearly been said by our NEFAC colleague, we have people living with HIV having long-term or chronic illnesses, non-communicable diseases, issues of reproductive health and mental health. And so we need to see how to integrate those within our care and treatment. And specialized labeling of standalone HIV comprehensive care clinics, again, they contribute to stigma and discrimination. And that's why we are thinking, how do we ensure that we incorporate it into the sustainable Taifa Care program? So, ladies and gentlemen, Theodore Roosevelt once said, being a good citizen demands honesty, faithfulness, and courage, virtues that are equally critical in this battle. We must come out of the emergency mode. It is time we had honest conversation on self-reliance and charting the path to a sustainable HIV response, as has been clearly been talked about by PS Kim Time. So in the coming year, our focus is to evolve and realign the HIV response through relevant legal and policy tools and plans. This will guide national and county efforts towards achieving self-reliance in the HIV response by 2030. Key reflections include strengthening of financing model, governance, and government institutions responsible for HIV, and building on His Excellency the President William Ruto's health reforms under UHC or Taifa Care through the primary healthcare strategy as the anchor for the transformation of the HIV program, and guided by WHO framework for integration of services and health system blocks, including human resource, commodities, data, and information system to increase efficiency, promote equity, and maximize resource utilization. Support of operationalization of the Social Health Authority that includes HIV prevention and control in the essential benefit package as a key tool to sustainability within the context of publicly financed primary health care is really critical. And the great news is clinical encounters for HIV, non-communicable diseases, and advanced HIV disease will be captured in this new model. And I urge all people living with HIV, let us enroll, let's get registered, let us contribute according to our financial capacity. Utilizing Kenya's enormous potential for local manufacturing of pharmaceutical and healthcare products, again, is really critical. Dr. Rose was sharing with me that the commodities would cost up to 27 billion. And that is why we really need you, Pepper, this time, even as we transition. But for us as a country, let us think of sustainable solutions. Let us leverage on the manufacturing industries that we have and see how we can have local manufacturing. Thank you, thank you. He understands local manufacturing of ARVs within our country. So behind every statistic, we know that there lies a life story of struggle, resilience, and hope. And today we honor those who have succumbed to AIDS and those who live with HIV and the communities, families, and individuals who stand with them every day. I also wish to acknowledge with admiration the efforts and immense contribution from the national and county governments, the partners including UN, PEPFAR, and Global Fund, the media, religious leaders, communities, CSOs, among others, who have been really supportive even to this. And we hope even for the last mile, a race to end AIDS, your support will continue. Last but not least, I want to acknowledge NASCOP and Nsdcc, the key institutions in my ministry that have ably driven this progress. Let us continue with the synergy within the ministry, the various sagas. You see Shah is now here. So it really calls for the ministry to work in collaboration and synergy. During his address to the nation last week, His Excellency President William Ruto reiterated his commitment to providing universal health coverage that is under through the flagship health reform initiative, now known as the Taifa Care. And on this World AIDS Day, let us commit to being part of these reforms, learning and listening to one another as we make progress towards perfection. Together, we will break barriers to health and create an inclusive society in Kenya where everyone, regardless of their status, can access quality, preventive, promotive, and treatment services, especially the poor and vulnerable. And so the Taifa Care reforms are critical in this juncture. It is a bold step towards equalizing and health services and ensuring no one, absolutely no one, is left behind. Our collective unwavering support and collaboration have saved lives, restored families, and it is the same spirit that will secure the hope of an end to AIDS by 2030 and drive us to self-resilience. Thank you very much.
All right, asante sana. Big round of applause for Waziri. Asante sana. And we'll see us just with your, if you indulge me, please, I'd like to guide you to that podium. That's a place where we're going to do the launch. And the executives in the front row kindly flank the CS over there. You will get a pair of scissors. That's where the official launch will be. I'm buying time for my media guys so that you get the perfect shot there. We said in God we trust. Everybody else must bring evidence, videos, and M-Pesa messages. All right. So this is going to happen in the next short while. We are launching 2 documents, a decade of progress in the country HIV response, and also Kenya's operational plan for enhancing country readiness to sustain the HIV response to 2030 and beyond. Now, the operational plan outlines Kenya's roadmap towards a country-owned HIV response. As they see line up over there, I'll be showing you videos on the screen so that you see what the documents are all about. Kindly make sure you have a bit of space there. There's some pyros that will come up, so make sure you have some space. All the dignitaries over there will be counting. We'll count down from 5 all the way to 1, but just make sure you have enough space so that there's pyros there. There's a bit of heat, so kindly step back a bit. To all my dignitaries, just step back and I'll count. I'll count before you count officially, so just step back to avoid the pyros. All right, in 5, 4, 3, 2, 1. There we go. And DJ, yes. Makofi. There you go. We're launching 2 documents there. They're right on your screen as well. Yes. A decade of progress in the country's HIV response. And Kenya Kenya's operational plan for enhancing country readiness to sustain the HIV response to 2030 and beyond. DJ Weaver on the deck. All right. That is also the point. We will take the hard copies and the CS will give them as follows. The Nsdcc board chairperson, just hand them over, just hand over the hard copies as you take the pictures. The CS will also hand over to the Principal Secretary of the Department for Public Health and Professional Standards, the hard copies. Also to the Nsdcc Chief Executive Officer, Dr. Marsha, Director General for Health, Dr. Patrick Amos, President Coordinator United Nations, ensure you have your copy, and then I'll request all of you to come to the front. I'll request all of you to come to the front once you have your hard copy, and then hold them up for a quick photo session. Just all of you come and line up the front over here. Once you have your hard copies, tafadhali, all the dignitaries just line up the front up hivi, so that we get you all in front of the cameras, and then hold them up and smile. 1, 2, 3. All the dignitaries just come and line up over here with your hard copies. Spread out. You want them up? All right. There's a request from the media people that you come up to the podium. Okay? That's all right. Just come up to the podium. All right. Let's have the dignitaries line up here. All right. There you go. Kindly line up and then hold up the books that you have, the reports that you have. Yes. There you go. Hold them up and then line up and spread out. Not too far. Those who are tall can go to the back. Move to this other side, tafadhali. And then hold up the books. And we'll be counting in 3, 2, 1. Ensure it doesn't cover your face. All smiles in 1, 2, 3. All smiles on the back there. Yes. 1, 2, 3. Let's get the pictures. Another moment there. 1, 2, 3, 4. And we should be good to go. Asanteni sana. All good. I'm always biased to my media people because we come from the same side. Are we good? Great. Allow my dignitaries to come down, and then I'll call upon Douglas Bosire. Douglas Bosire to come and give a quick vote of thanks. DJ Punguza Kidogo. As the dignitaries settle down, let me call upon the World AIDS Day 2024 Planning Committee Chair, Douglas Bosire, to give a quick vote of thanks.
Thank you very much, Trevor. The Cabinet Secretary for the Ministry of Health, Dr. Deborah Barasa, and the entire entourage of government and non-government actors that have accompanied you. Gertrude Stein, an American poet, once said that a silent gratitude is not very much useful to anyone. And we take this opportunity, therefore, to just come to the podium to thank all of you for having turned up in large numbers, not only in the planning process, but also in the commemoration of this very day. We sincerely are grateful that, Madam Cabinet Secretary, you took your time and came to launch this half marathon about a month ago at the Landmark Plaza. And actually, today you are here to witness the marathon itself. Makofi ya waziri tafadhali. We appreciate you. We appreciate your principal secretaries, Dr. Ari Kimtai. We appreciate Mama Mary Mudhoni. We appreciate the DG. We appreciate the entire Ministry of Health. We acknowledge the support that you have gotten from the Nsdcc board, led by Chairman Geoffrey Gitu and the CEO and the entire board of directors, because you gave us a chance to plan for this event. And I think we have not done a very bad job. Where we have missed, before all these people, we asked you be a bit lenient. Musahau tu hiyo kidogo, msikaangalie hiyo. Mtuache siku moja tu, hata waziri amesema sawa. Thank you. The Nairobi City County, they were here. Madam Waziri, we had 1,000 community health promoters from Nairobi City County. They were here with us today. The CC member is out of the country and she has sent apologies. But they are with us and we work very, very closely with them. to our heroes and heroines of the HIV response, the communities of people living with HIV, the communities of adolescents and young people, the communities of the key populations. Makofi kwa tafadhali. They have stood with us, and you saw during the cake cutting here, they came, they danced, and they sang for the prosperity of this country. Our development partners, both bilateral and multilateral, Dr. Stephen Jackson was here shortly, PEPFAR is here represented by Brian Reitman, and all of you, the Global Fund is here as well. Thank you very much. We really sincerely appreciate. The KCM chair, your KCM team was here today. Asante sana. Thank you. Our implementing partners, both from the state and the private sector, Dr. Kinyanjui is one of them. And allow me, Madam Waziri, although we are short of time, but allow me to quickly mention some of the partners that we have worked with, because this is the multi-sectoral response that we are building, because we cannot do it alone as the health sector. Athletics Kenya, who have managed this thing with us, we did not know where to begin, but AK held our hands. They are represented here, Ondieki is here, and their chair was here, Tabut. You could see, even they showed us how to shoot the blanks. Yes, thank you very much. PS Kenya, Antol Plus, Huduma Kenya, Sports Kenya, who are the, who are the owners of this stadium, Ministry of Foreign and Development, Ministry of Foreign Affairs and Ministry of Foreign and Diaspora Affairs, Maybets, AHF, Kenya Medical Training College. The CEO was here and he ran with you. Mount Kenya University, Kenya Urban Roads Authority, Kenya National Highways Authority, Kenya Medical Supplies Authority, AMREF, UNICEF, Pepsi. The Pepsi gave us 30,000 bottles of water. Clap for Pepsi, please. Thank you very much. PHDA, TV47, Africa Heart, Anti-Doping Association of Kenya, ADAC, Guru Nanak Hospital, Sifao, the ones, the Toyota people, they gave us the lead car, which was also timing the athletes so that we could know who won fairly. National Police Service, National Youth Service, National Police Service, and National Youth Service, Madam CS gave us 500 officers. From yesterday night, they have been at work, and they are still at work. Makofi kwa National Police Service, and anyways, thank you. LVCT Health, NEFAC, USAID, Ampath, Uzima, Medionics, Equity Afia, Lions, Nairobi West Hospital, Kenya Pipeline Corporation, and I think the CEO of Kenya Pipeline Corporation is here, Kenyatta National Hospital, UNAIDS, CF Kenya, OraQuick, NCBA, Kenyatta University Teaching and Referral Hospital, Blue Shield, Kenya Red Cross, Bwana PS gave us 12 ambulances. 12 ambulances, and they have been with us today. Thank you very much. NASCOP, Dr. Rose, you are here. Thank you for giving us your team to plan with. NACADA, the CEO of NACADA is as well here. Asante sana for this journey of ensuring the health and well-being of men and boys. The members of the Fourth Estate, the media, they are the ones who have reverberated this story, and they're the ones who made the people aware about this activity and therefore register. Our able MCs for the day, Trevor and MC JC. Makofi kwa Trevor and MC JC tafadhali. Now the artists who are here, I saw CS today dancing Ananguka Nayo, you know? Anguka Nayo. Wadaglis mko wapi? King Kaka. You brought the house down, man. Thank you very much. And I think we are going to have a lot of it in the afternoon, isn't it? You are here with us, eh? Thank you. We are not going anywhere. Asante sana. And then, Madam CS, lastly, the ABO committee that we are planning with. I was the chair, but we had two co-chairs, Dr. Murugi Misheni and also Caroline Kinoti. I cannot forget to thank you enough. Lastly, we really appreciate the hand of the Almighty God, because yesterday, the day before, and on Thursday, Nairobi was raining. We were very afraid that today would rain. We went down on our knees and prayed that today, let the rain come in the afternoon, in the evening, after we have finished with the race. And indeed, the Lord has blessed this day, and you can see it has turned out to be a success. A round of applause, please, for the Almighty. Thank you very much. May God bless you. Our greetings to your families, and stay safe. Mungu awabariki. Thank you.
Thank you very much. Asante sana, Dr. Bosire. A round of applause for Bosire. He was the chairperson of who was planning all this, and it was successful. Now, without any further ado, we promise you will end at exactly 1. It's 9 minutes to 1. Let me call upon my co-MC, MC JC. Yeah. Wapi makofi MC JC, by the way. Aha, over to you now. Sasa wewe ndio tuombe tufunge hii program.
Mimi lazima niwaombe, usijali. And Madam CS, thank you so much. Huyu ni mmoja wa wale kina mama ambao wanaongoza taifa hili kwa heshima na taadhima. Tumpigie makofi dada. Do you know what it means to have a woman leader? Do you know what it means to have a woman leader nyinyi? Mnajua sisi wa Meru tuko naye. Mnajua ngavana wetu anaitwa nani? Nani? Kawira Mwangasa. Si mnamjua? Mnajua zile shida tumempatia nyinyi ya muelewi. Hata sijakasirika. I'm still very happy. Huyu mandamu huyu mnafaa hata mfurahi tuko na mandamu. Because uko Meru Kawira na anamesumbuliwa uko Meru. Anaimpichiwa kila wakati na aendi. Lakini shida pia akiongea tunashtukanga. Trevor, hata afadhali nyinyi huko kwenu Kisumu amna shida ya matamshi. Sisi tuko na shida ya matamshi. Kawira akienda kuongea hapo kwa bunge, saa ile anaimpichiwa. Akiongea Senate, sometimes I feel embarrassed, but ni shida ya matamshi. Ni mkali Meru, anasema nyinyi wanaume nitawafinya wote. Lakini akikuja kwa Senate anajifanya mhambo. Honorable Chair, I want to say that it is because I'm a woman that I'm going through all this. 2022 was the hardest election I've ever seen. There is no election I participated in that was harder than 2022. And so, Honorable Chair, that election, the way it was hard, there were many men, but I was the one who was on top.
Asante Jesse, asante.
So now, ladies and gentlemen, tukimalizia kwa sababu lazima tuende, PS ako hapa, wote wako hapa, our leaders wako hapa. We are going to do. Hatujamaliza. We have a color fest. We are going to launch it there. PS Kimutai. Sawa sawa. So tutaenda hivi, tutaandamana na nyinyi. Tuingie tupande on stage. And then we launch the color fest. It's very beautiful. After that, then I'll be able to release you. Najua CS ameenda pale, but ajaenda. Hata anaenda on stage. She's aware. So you are going that way to pande on stage to Malize. And King Kaka is there, Wadaglis are there. So for
Kayamba
now,
Africa.
For now is Kayamba Africa. Watuongoze kwa wimbo wa kumalizia, because we are not done with the program yet. So tutatoka sisi wote, twende pale kwa concert, launch Color Fest, tusherekee.
Kabla Kayamba naomba Shaban Latif. Shaban Latif haja tuombe. Shaban Latif, are you here? Shaban Latif, closing prayer. Kabla Kayamba Africa. Kama yupo, turudi kwa Mutuse. Mutuse atuombe basi. And then we hand over to Kayamba Africa.
Let us pray. Our Father and our God, we thank you for this far you have taken us. We prayed when we were starting, and Lord, we have seen the end of this event. We praise you, and at this moment we say, let honor and the glory remain to you. Thank you, Father, for what has been remained. Help us and be with us. And we thank you, Lord, because at the end of everything, we shall glorify your name. In Jesus' name we pray.
Twende kazi DJ.
Kayamba Africa ukiendelea na entertainment, there's the next session.
DJ tafadhali tuende mlongo.
Okay. So tafadhali Kayamba Africa unaendelea na entertainment, you may head to the right. First. Uko to the left actually. It's to your right, but it's to my left. Okay? Kayamba Africa.
DJ. DJ, please.
In the heart of Chepsaita lies a story. a story of resilience, hope, and dreams waiting to be fulfilled.
Unatazama Sound Candy Talk. Toa sauti yako usikike. Kutoka Ongata Rongai Kajiado hadi Rongai Nakuru. Hii ni Sound Candy Talk. Tuko bora kwenye mitandao ya YouTube, Facebook, TikTok na X kwa taarifa tendeti, udadavuzi mwafaka na makala muhimu yanayokuhusu. Tazama Sound Candy Talk upate ufahamu. Kutoka Kimilili Bungoma hadi Kiminini Trans Nzoia. Hii ni Sound Candy Talk. Kutoka Kimilili Bungoma hadi Kiminini Trans Nzoia. Hii ni Sound Candy Talk. Kutoka macheo hadi machweo, tunakupakulia yanayokuhusu kwenye vipindi vyetu.
When the issue of Eurobond was floated, we objected to it, but no one listened. Now we are here again.
Ile mapato ya serikali haijaonyeshwa pale, imefichwa. Ndio tusijue tunachanga shilingi ngapi ama tunatarajia kuchanga shilingi ngapi kulingana na mikakati na mpangilio ya serikali.
Budgeting process takes care of revenue versus expenditure. Why are we dwelling so much on expenditure and no disclosures are being made on revenue?
Daily Bite, one-on-one show. In the news headlines, kisha open forum political show. Sound Candy Talk, indeed. It is seeing live for masses.